En 5 segundos.
Hola a todos. Muy buenos días.
Good morning, everybody. Please welcome to the second session of this workshop. This is the workshop of the Panacea Network. Yesterday, we had very interesting presentations. We had many attendees as well, more than 150 live, and more than 800 hits of the videos during the day. We had more than 500 people enrolled, so it was very successful. At the end, we will share some additional figures with you. Please be welcome. Today, we will be focusing on case studies from different countries, Europe, Africa, mainly Latin America as well. And before starting with our presentations, I would like to give the floor to Dr. Marcos Quintela that will make a summary of what we discussed yesterday. Go ahead, Marcos. Thank you, Julian. Good morning and good afternoon, everybody. Yesterday, we had a great day. We had top-notch speakers that have really gave us a lot of insight. I'm sure that there will be questions on how this knowledge, how these initiatives can escalate from pilot projects to country-wide projects. Professor Gonzalez, Professor David Graham spoke about the information that we can get today from wastewaters. This is an important problem with antimicrobial resistance, and it accounts for at least 10 million deaths per year. We've seen the complexity of antimicrobial resistance and the methods that we can use. And now we have mass methods that can give us a lot of information. Lars Estra told us that in weeks, his research center became an important center in Sweden to do the sequencing of the coronavirus samples. Those capacities support the Panacea network. Glass also showed some mass developments that can be achieved for detecting antimicrobial resistance. And also, this is a turning point for our technology, but also for the Panacea objectives. And finally, I would like to thank the attendance of two important representatives of the PAHO and the World Bank that have spoken about their vision. They have a broad vision in this region where there are many inequalities, and also technology is very important, and technology needs to encompass all social status and must be useful for those that make decisions. Today's sessions are focused on getting to know the reality of the use of wastewaters in different countries with different settings. We'll have our pleasure to take a journey in the next 3 hours where we will look at presentations, we will go over South Africa, and we will finish off with efforts from different countries. I must say that we have had to select some regional projects, but Panacea includes many projects from different countries, and for time considerations, we've not been able to include them. You will be in good hands today, and I hope that you will be able to enjoy as you did yesterday or even more. Thank you very much for joining us. Thank you, Marcos. Julian. Good morning, everybody. It is our pleasure to share with you today. It is my honor to be the moderator of session 3 with Santa Maria, and today we will be having these first talks in this session. I would like to introduce the moderator for this morning, Dr. Mónica Santamaría. She is a biologist and biotechnologist from Lima, Peru. She has a PhD from North Carolina in the United States. We post PhD studies from the University of California in the United States. She also teaches and she's a research at the Engineering and Technology University, and she's part of the Center of Research and Technology of Water. She has been carrying out some works in the city of Lima in Peru, together with the Ministry of Sanitation of that country. Please be welcome, Monica. Thank you. It is my honor to be here in such an important and relevant workshop. It is my pleasure to introduce you, Pablo Rivera. He is a microbiologist, clinical chemist in water research and health environment from the Costa Rica Water Municipal Institute. He also works with sewage waters, and he is institutional representative in Costa Rica for environmental microbiology and health with 10 years of experience in work related to water quality for human consumption, superficial water and wastewaters. I would like to introduce the first speaker for today, Dr. Jasmine Grimsley. Jasmine, are you there? Are you there? Hi. I heard you today, earlier this morning. Jasmine, she's head of research and development, environmental monitoring for health protection, the UK Security Agency. Her work in environmental surveillance for the protection of health in the Health Safety Agency in the UK tries to develop knowledge based on wastewaters on the COVID-19 pandemic and to release the use of wastewaters with biotechnology.
Please, you are welcome to start your presentation.
Thank you. It's an honor to be invited today. So I'm from the presenting today on the wastewater program in England and how it's developed and where it's going in future. So I'm part of the United Kingdom Health Security Agency. So the role of this agency was new and it's set up on the back of the pandemic, merging different agencies. And the aim of it is to ensure health protection outcomes for the country by leading, responding, preventing, detecting and analysing. And wastewater surveillance was set up as part of this agency when it was the division of this agency that was called the Joint Biosecurity Centre. That's now part of the UK Health Security Agency. So this is a map of England, and the areas you see coloured are the areas where we were surveilling from wastewater treatment plants at the peak of our surveillance. At the peak of the pandemic, we were surveilling from over 470 sites across England between 4 and 7 times per week. This covered more than 74% of the population. And we were able to detect BOX, so variants of concern, and variants under investigation via genomic sequencing. These were used in a central variant response to allocate resources and to respond to outbreaks and for local public health action. Rapid advances are being made in our ability to estimate prevalence and demand forecasting from wastewater signals. And we're still rolling out wastewater surveillance in near source locations such as prisons. So how did we get there? Well, we started off with 44 treatment works as a part of a pilot to understand if wastewater surveillance would provide an indicator of prevalence at community level. We compared those data to a longitudinal study that's ongoing of patient levels, population levels of COVID in the community. And we found that we were 0.97 correlated with these. This was really, really promising and gave us the confidence we needed to scale up the sampling to provide better insights on outbreaks in the country. We also did within network sampling, breaking up segments of a city into sub-areas to understand if not just sampling at wastewater treatment plants, but in communities and parts of cities could provide more granular insight. We also went more granular still by sampling at universities and schools to understand if we could identify outbreaks early and be part of a response package in near source environments. We work very closely with directors of public health and local health teams and epidemiologists to understand the use cases for these data. Where could it be used and where could it provide insight, and what data gaps could we fill with it? We then, on the back of the success of that, scaled up within city sampling. And we did this by identifying optimal catchment areas that would pick up parts of the community that had lower uptake of testing or where people were more at risk of poor outcomes if they were infected with COVID. So this way we used looking at areas where perhaps there were low test intake, pivot point areas, so areas where they knew that if there was an outbreak in here, it might accelerate quickly, where we wanted to know it really early. And by working with local directors of public health and the users of the data, we were able to provide them with the data they needed and help ensure that there was good value for the data we were collecting. We also scaled up to cover 70% of the population via surveillance at wastewater treatment plants, again, prioritizing those areas where people were most at risk based on demographics or occupation. We evaluated this and related it to other health indicators, seeing where it added value and seeing which areas it was added the most useful insight for users. We underwent continuous improvement, looking at methods to control for the normalization of the signal and the impacts of rainfall. It's, I think, pretty well known that in England it rains quite a lot. And when it rains for days. And so normalizing for rainfall was really important for us. Although it had very little impact on the data because we don't have so much combined sewers, I think it made the users a lot more confident in the data to see that there was no impact of rainfall on it. We worked really hard with public health users and the users of our data to make sure we could communicate the data in a way that was insightful and highlighting the things needed for the customers so that they could get the best insights they needed from these data. In December 2020, we started our experiments to see if we could surveil for variants of COVID, looking at VOX and buoys. And this was really promising and really well related to outbreaks in areas in our pilot studies in Bristol and other areas, looking at how it related to outbreaks of known variants. So we scaled that up too. And by April, we're sequencing most of the locations we were doing in the country and then scaling up to doing all locations at least twice a week. But our next steps are really around validation of wastewater as an indicator. Where does it really add value in the big picture? And how do we set up a system that surveils for COVID and other pathogens and other public health markers to help towards our mission of health protection? And this can incorporate other pathogens, health markers, well-being markers, and mental health markers as well. So with our monitoring for variants, we've worked with a really strong group of collaborators to develop the methods that we use. We do a modified Arctic protocol looking at combinations of SNPs and mutations to see if these have we have a different category for each VOC and buoy. So instead of saying it has to have 3 or a certain percentage, we work with our genomics colleagues to understand what are the best combination of mutations that we can use to identify each VOC and buoy. We're also doing development of methods to look at novel pathogens out of these signals, as well as the identification de novo of COVID variants. This has been really useful. We've managed to identify novel mutations in wastewater from a northwest region of the country and worked with local incident management teams. So these are the teams that manage what we do if we see a public health outbreak, and coordinated with them on how to respond. This involved collaboration across the United Kingdom Health Security Agency and other government agencies. And we were able, using wastewater, to provide new scientific insight and really able to demonstrate the potential of wastewater for identifying novel variants. We're also working with commercial trials to support other government agencies or other parts of the civil service. such as the Department for Education and Care Commission and surveillance in prisons. But then our partners at CFAS and in the Environment Agency are working really closely to develop lab methods and certification guidance, standards and guidance for the use of WBE and generic protocols, and running the ring trials that we use across the systems, and making sure that we can publish and share the methods and protocols that we use in the labs. Within the research space, we're working really closely with academia and industry to prove the insights. And these are 8 of our ongoing research areas. We're working on beyond COVID pathogen detection. So these are aspects such as norovirus, flu, enterovirus, RSV, as well as looking at these in the field, as well as in the lab for methods. And I think many of us would like to understand exactly how many people are in each of these samples that we look at. So we're looking at chemical markers of population. These can be including things like caffeine and other chemical markers to give us the indication of how many people are in a population at any one given time. This is really important for helping us move towards prevalence and demand forecasting models. I mentioned earlier that we're looking at these different methods to identify novel variants, as well as looking at ways of optimizing this in a high throughput environment. How do we get the best RNA out of each sample while using a system that is robust, scalable, and has easy access to the supplies? I think through the last couple of years, we've all probably had issues now and then with supply chain. We'd like to come up with methods by which we can send our samples without needing to cool them. So we're investing time and effort in looking at ways to ship samples without the need for cooling. And in the future, we'd like to see post-pandemic sensors. So sensors at wastewater treatment plants in key parts of national infrastructure to provide early insights and automated analysis of viruses, bacteria, and fungi that could be deployed across the country and move into a central database. And sampling. It all comes down to sampling at the end of the day. And I think many of our issues around getting the best data possible are around getting the best sample out. So we've been working to look at the different pros and cons of different samplers, developing new samplers so that we can get the best sample out of the ground that gives the best insight of the underlying population. Then at Borders, we've been working to understand how we need to adapt the laboratory protocol and what the social representation is of the sampling at Borders. So where is the right place to sample to get the best insight on who's coming in and out of the country with pathogens? Where in the sewer network should we sample it? At aircraft, airport, at seaports, or at major travel hubs like bus stations to provide this early indication of what pathogens are coming in or moving around a country. This is some work we've done in collaboration with Bangor University through the Vivace community. And we've done a lot of work with them comparing the pros and cons of GRAB and composite and trying out lots of different passive samplers for looking at COVID, flu, norovirus, and other chemicals, as well as other pathogens, to really understand what the best timeliness is for the deployment of passive samplers and which locations one needs to use a passive sampler as opposed to an auto sampler. And this is just a nice image of one of the COVID sensors that we've been working with collaborators to develop, which will provide us insights on COVID. And we're working towards the development of these in the future, which is our long-term vision around other viruses and other chemicals deployment in the field. And here's just a few of the publications that have come out of the team recently. Thank you. Any questions?
Thank you very much, Jazz, for your interesting and comprehensive presentation on the efforts that you're doing in UK on wastewater monitoring. We have time for a few questions. If you are sharing it by chat, I think. Marcos, could you tell me how are our audience providing the questions? Okay. So I have one question, yes, that has been a problem for our efforts in Peru. How are you normalizing your for flow in your composite samples?
So we're normalizing for flow by looking at inorganics, and so we've related flow to a model based on the inorganics that we measure in every sample. I'm happy to share that method with you and the algorithm that we use, but it's really nice actually. You can even see the point of peaking, etc. And we do that in all of our reports as well. So we flow normalize, but we can only flow normalize to a certain level. And so when things are extremely dilute, so it's not such a problem at wastewater treatment plants because we tend not to get it completely wash out the signal, but in network, close in an area where maybe has more infiltration, then you have to have a cap on it.
So if you have scenarios where you have heterogeneous populations, like in Latin America, it's a peculiarity of large urban areas that we have different population with different, average income levels, and they have different water use. So is this inorganic approaches able to also control for water usage, or it's more towards fluvial contributions, like fluvial contributions?
It should account for those because it's based on the nitrates, etc., that are coming from human waste into the sewer system. But yeah, we found no demographic differences on the degree to which we need to normalize, but that might be a nuance of the English system.
Mm-hmm. Okay, we have one last question. Sorry, my question from our audience is how wastewater data is used by decision makers.
So this is a really useful one. It depends on the decision maker. And so in many ways, our wastewater surveillance system is designed in different ways. So we had the original 44 sites, and this national surveillance at wastewater treatment plants gives the insight higher to government on the scale of the pandemic and how it's changing and the direction at community and regional levels in the country to understand, how has that affected where we are with the MPIs? How comfortable are we that cases are going down, or are they starting to come up? These sorts of insights. Whereas in local areas, they've been able to be used for the deployment of resources. So follow-up testing. We did once the pushing of postcode tests, so tests every household, and then the deployment and prioritization of sequencing and these sorts of things. So there's lots of different options available for how it can be used. I'm really excited about the future potential in the space of making it really open to the public and this behavioral insights that the public can have based on it to make their own decisions based on data.
Thank you very much, Jas, for your presentation today. We are right in time for our next speaker. I'm happy to introduce our audience with Dr. René Street from the South African Medical Research Council. René es directora interina de la Unidad de Investigación de Medio Ambiente y Salud del Consejo de...
She works in environment in the Medical Council of South Africa, AHMRC. She's leading the program of persistent toxic chemicals as response to COVID-19. Dr. Street has been critical in the creation of a research program and wastewater monitoring system to monitor trends of the RNA of SARS-CoV-2 in South Africa. So I want to tell you that starting now, we will have individual presentations. We will be presenting specific cases from different countries. So we will leave the Q&A session to the end, okay?
From now on, we are presenting case studies from different countries. So we are going to leave the Q&A session to the end of all these following presentations. So Thank you very much for your contribution to this workshop, and please go ahead with your presentation.
Okay. Thank you, Monica. I'll share my screen now. Can everybody hear my, see my presentation and hear me properly?
Yes, we can hear you well, and we can see your presentation.
Excellent. Thanks very much. So today I'll spend, and again, thank you very much for the invitation. I'm very happy to be here and to share our story about tracking SARS-CoV-2 in South Africa. I'll be speaking a little bit about the different, the 4 waves we've had in South Africa. So I'm just trying to move, okay. So our program started in March 2 years ago, and as the discovery of SARS-CoV-2 RNA was isolated for the first time in wastewater, we quickly decided to see how we could, as well in South Africa, how we could contribute to this, and started investigating the environmental-based epidemiology in South Africa to tackle the COVID-19 pandemic. In May, we started planning for this, and by June, we had our first proof of concept where we managed to isolate and quantify SARS-CoV-2 from our first wastewater samples. Soon after that, we realized that we needed to do a field proof of concept to really figure out the logistics of how we would expand on this program. We started on expanding quite rapidly in July, and a couple of months later, we became a wastewater surveillance and research. From a project, we went to a full-scale program, and this we've been, expanding our program ever since. Oh, sorry, my cursor isn't working to move the slide. Oh, there I go. So the program started out at the SAMRC with 4 units working closely together, bringing different skill sets together. So my unit is the Environment and Health Research Unit. We do the overall program facilitation from the fieldwork, logistics to the stakeholder engagement. We work very closely with our lab team, the Biomedical Research and Innovation Platform, who do the lab QC and analysis, QC, and training. We also have a genomics lab that works on our variants of concern and variants of interest, and also a biostat support center we work closely with that includes some modeling work. So as I mentioned, in early July of 2020, we set out to answer some key questions and started the proof of concept. We sampled from 24 wastewater treatment plants in the city of Cape Town over a 6-week period. And on the left, you can see here is the COVID-19 case numbers over a 6-week period, going from a peak. Cape Town at the time was the epicenter of our first wave. And you can see over a 6-week period. So I'm not sure if you can actually see my cursor. Let me try. Can you see my cursor moving?
Yes, Rini.
Okay, super. So you can see the waves going down across over the 6-week period, the COVID-19 cases, and from left to right, these are our SARS-CoV-2 wastewater results. So we managed to map all of the over 700 suburbs to the different wastewater treatment plants, and the high viral loads are the where you can see the red. And this meant that there was a lot of viral shedding in the wastewater during that first week of July. 2 weeks later, much less, signified by the orange. And going towards the end of our 6-week period, there were very low SARS-CoV-2 levels, all green, which really did coincide well with the case data that we were seeing. So during this time, we actually also set up SOPs for sampling. We did lab training, and we realized that we were ready to expand on our program. Oops, sorry, I'm just trying to. Sorry, my slide isn't moving. Just give me a sec. Okay. Once we had some key answers to critical questions, we designed an outline of our program with 6 key elements. The first was the research element. Of course, we were driven by key research questions, including aspects of genomics, variants of concern, and a range of other emerging questions as our program rolled on. We had numerous wastewater sampling sites at strategic settings, including some rural settings, peri-urban, and in the urban centers as well. We use one standardized method across all of our sites, and this is the lab QC is done by our reference lab at MRC. We are one of our key elements is to build capacity across the space and to develop a critical mass. So we work with partner universities. We provide the training. We managed to get funding to provide a lot of the equipment. And we work closely together with these partner universities, which include staff and students. And the majority in the South African context, we work with the under-resourced institutions to make sure that they have the capacity to do this work with us as well. We have developed an early warning system. That was one of our main objectives in the beginning. From November 2020, we have a public-facing dashboard, and we continually try to enhance the way we communicate our results to stakeholders. Of course, one of the last items is the research uptake. It's important to engage with the public. So many, research articles, lay articles, social media statements, and media alerts. On the right is the map of South Africa to show where we work. We work in 6 provinces right up from the north. These are our partner logos along the way. And we work in Limpopo, Gauteng, Free State, KwaZulu-Natal, Eastern Cape, and the Western Cape, where our reference lab is. So in November, we had our second wave, and from early November, we started collecting the wastewater data from all 24 wastewater treatment plants within the city of Cape Town, so covering the entire city, which coincided nicely with the start of our second wave. So in this graph, you'll see we took an average of all the 24 wastewater treatment plants. And here is the wastewater signal, which follows quite nicely as you want to see the lag between, the wastewater signal and the case signal. And here you can see, about 10 days later, the case has increased as our wastewater signal decreased towards the end of that second wave. The cases followed as well. This was using the lowest smoothing, and it just gave us confidence with the second wave to make, to ensure that we were on the right track for an early warning system. So towards the end of our second wave, which was driven by the beta variant, we also started doing rapid targeted surveillance using PCR genotyping. And this is when we realized that there was a change, and the emergence of the Delta variant happened. So when we started picking this up in week 30, we could go back and quite easily see in week 20, dominated by the beta variant, we could see exactly in that same week 20 where the Delta variant was first introduced. It was at these 2 areas within the city of Cape Town. And 10 weeks later, we could see how it spread very rapidly the whole of the city of Cape Town was dominated by this variant. We've now rolled this out to our other provinces as well. We managed to look back as well and show the difference between the beta wave and the delta wave. The waves acted very differently, which it did affect, how we would do the risk communication and our alerts, because we were very surprised. The Delta variant, the spread of the SARS-CoV-2, the ranges were much bigger. The viral loads shedding was much more increased, and it was just interesting to now compare between these two waves the spread of the data. So, a clear wave here and a clear wave here. The case data was similar in both of the waves, but a very different look and feel with the SARS-CoV-2 wastewater data. We had a quieter period for a couple of weeks where we had really low SARS-CoV-2 levels and very low case numbers. But in mid-November, we were pooling our urban center data, which you can see here by these 3 lines. And we did notice, it might not be so clear here, but individually we were looking, and there was a lot of volatility in our wastewater signal. And we watched that for a little while until we issued a press release on the 15th of November to say that, there is volatility. We can't quite, we're not sure what it means exactly, but please do take care and watch out. A few days later, that is when the announcement was made of the novel, or the new variant that was detected in South Africa. It's now known as Omicron. So we definitely did pick up a couple of days earlier that there was something up within our wastewater in the program. So for the last couple of months, year and a half at least, our program follows a cycle of every Monday. The sampling teams go out to the different sites. The samples are delivered to the lab by midday, so the RNA extraction can begin. It's quite a lengthy process. On Tuesday, all the labs do the PCR analysis and also the quantification. On Wednesday, there's a lab meeting at 9 o'clock in the morning, a lab huddle for all the labs to get together, discuss if there's any issues. They can go through QC together, and only once all the labs have passed the QC, the data gets brought to another team for the statistical analysis, preparation of graphs and maps, and preparing information to the key stakeholders. The information also gets updated on the public-facing dashboard. And this allows, at least for the 2 days, so we want to do it as early as possible so that the key stakeholders can intervene at facility or community level should there be an increase in SARS-CoV-2 in those areas. So I mentioned that skills transfer and capacity development is a big part of our program. We've developed sampling guides for grab sampling as well as the passive sampling that Jazz also mentioned in her talk. We do 2 types of training. So the one is obviously the SARS-CoV-2 analysis, where the university would be invited to the MRC campus, and they have a 3-day face-to-face hands-on training. And then, of course, the weekly lab support after that. It is a train-the-trainer model. So once the people have been trained in the lab, they can then train others back in their lab, obviously with the support of the reference lab. We also have the variant testing training. This was rolled out during a peak, one of our waves. So it had to be taken online and actually worked very well. And that same variant support is provided weekly as well. And we've also just reached out to some of our African partners to provide similar training to them as well. We do work hard, but we also do have a fun capacity development side to us. We've just had 2 big writing workshops. So we take the students who are working on our program. Some of them are registered, some of them are just working to fund their studies. and we've taken them away on workshops to support their writing, academic writing, to get lists of papers together. This picture here is to do with, we were doing the art of science, where people had to commit and sort of pledge what their interests were in wastewater-based epi and how it fitted into the community model. So it's also about networking, bringing people together, and bringing the critical mass together in a way that everybody can share ideas as well. So as we have the data as it comes off after it passes QC, the data goes off into various directions. I've mentioned our public-facing dashboard. We try to reach as many people as possible. We have a 3-tiered government, so local, provincial, and national. And depending on which area we're working in, we can work from environment and disaster management teams to the Department of Health, water sanitation, engineering services, a whole range of groups of people that have shown interest in the data. We also have social media campaigns in our local language to try and attract people to the dashboard, especially during peaks, to inform people, okay, there might be a rise in your area, please look at the dashboard, see what's happening in your local area. The program's also attracted a lot of media attention. So as we have press releases and we are alerting the public to what's happening in the data, often we called on to for different interviews or media statements as well. So that's a very busy part of the program as well, that I think I underestimated when we started off. We have so many different partners. I think we need to update the slide every couple of weeks, because we keep on getting new partners, and it's really fantastic. We've had such wonderful collaborations and support from so many different people across the globe. So not only collaborators, but of course funders as well. So lessons learned. Right now, although we've got 2 years worth of data, or nearly 2 years, we do need more time points. Multiple years of data is required to infer seasonal trends. For us, each wave has been driven by a different variant of concern, with each wave behaving differently. So it's hard to compare, wave by wave if they're so different. Our case data is not available per wastewater treatment plant. The boundaries for the catchment and the health boundaries are often different. The case data only reflects diagnosed cases. We have changes in algorithms, depending on what happened in the political situation. There'll be different things happening with the testing. I know, for example, at a peak of a wave, sometimes, there's an instruction that only people over a certain age can test, the higher risk groups, for example. So that then affects, the cases. So it's not easy then to, connect what's happening with the case data to the wastewater data all the time. In terms of way forward, we definitely would like to expand the depth and the breadth of our network, looking at other interesting things such as AMR, pharmaceuticals, other pathogens. We will now also look into, and we do look into, retrospective analysis of the variants of concern, with the main aim to reduce morbidity and save lives. And just on my, I think, second last slide, just to show you, we're really going to now expand beyond SARS-CoV-2. We hope to be monitoring the absence of it in the near future. And our platform is built on agility and adaptability. And so it's set up to expand for so many interesting areas. Using just one sample, we could look at numerous things. Most of our current lab partners have expertise in AMR. I know it's an interest of this the group on this call. And we are now expanding our research into the AMR sphere as well. Just my last slide, just of thanks to so many different people. This is a very big team that we work with, and it takes so many different partners, municipality, academic partners, funders, communities, scientists, and we have a think tank as well. So just plenty of gratitude for them. So thank you very much. That is the end of my talk, and I'll gladly take questions at the end. Thank you.
Thank you very much, Renee, for your great talk, great effort that you are doing in South Africa. Really amazing all the results that you are obtaining and the great work. We are collecting questions towards the end, and now I'm going to leave the hosting to my colleague, Pablo Rivera from Costa Rica. Thank you.
Gracias, Mónica. Para continuar con la presentación.
Thank you. To continue with our presentation now, we will see the national epidemiological experience that we have had in the case study in Mexico. And for that, we will have the honor of having the presentation made by Dr. Maria Elena Velázquez Mesa. She is a professor and researcher in medical sciences in the Research Center of Infectious Diseases of the National Institute of Public Health since 1990 up to date. And also she is member of the National Researchers Group and her research line. And also, we will have Dr. Julián Carrillo Fuentes, who is associate researcher of the Engineering Institute of the Autonomous University of Mexico. And Dr. Carrillo is a doctor, has a PhD in applied sciences. He is a researcher and has been in national and international congresses, has more than 30 publications and articles in international journals, and also author of 4 chapters of books in his own specialty. His line is microbian research for hydrogen and also indicators in wastewater. In the pandemic, Dr. Carrillo developed the first studies of genetic material of SARS-CoV-2 in wastewaters as an epidemiological tool. So with no further ado, they have the floor.
Buenos
Gracias,
días,
Pablo.
¿me escucha?
Buenos días, doctora. Adelante, doctora.
Hello, yes, please go ahead.
Tu pantalla, doctor. Buenos días.
Hello, doctor. I'm going to share my screen.
Buenos días a todos.
Good morning, everyone. First off, I would like to thank the opportunity to be here. I represent Dr. Celia Puche and the work she carried out at the National Institute of Public Health. This work is entitled Map of Clinical Use of Antibiotics and Reservoir of Bacterial Resistance Genes in Wastewaters. I shall say that antimicrobial resistance is a global health problem. Therefore, the World Health Organization developed different action plans to fight this problem, particularly in the official Gazette of the Federation in Mexico, an action plan against antimicrobial resistance was published. It is important to start this national program in the rational use of antibiotics, including antimicrobial resistance and also an antibiotic management program with minimum standards. Also, the antimicrobial resistance has different factors. On the one hand, we have the prescription practices, regulation practices, characteristics of the population. All of those features converge in the microorganisms, in virulence and others. These medically important bacteria that are antibiotic resistant are present in hospitals. And because of what this represents, they have made it out to other areas such as wastewaters. Wastewaters are considered and described as reservoirs of antibiotic resistant microorganisms as well as resistant genes. The wastewater treatment plants, in order to treat wastewaters, have as a purpose to protect water bodies and the environment by reducing organic matter, chemical contaminants and microorganisms. And in the wastewaters, the presence of clinically important bacteria have been seen, like in vancomycin, resistant enterococci, as well as some resistant genes that are resistant to later generation antibiotics. One work that that shows the evidence of this antimicrobial resistance in wastewater is the paper that were work by 7 European countries, where they analyzed 12 wastewater treatment plants. The countries were classified as high and low antibiotic consumption countries, and it was detected that antimicrobial resistance present in wastewaters was related to the clinical use of antimicrobials at hospitals. Also, these results showed the need to make special studies depending on the geography involved, because this varies depending on where the study takes place. So Dr. Alpuche developed this research project in order to detect resistant genes and resistant bacteria in wastewaters. This study had 5 objectives: to describe the clinical use of the antibiotics, to detect the antibiotic resistant strains, also the susceptibility profiles and the genetic features through metagenomics and genomic studies. As the first results of this study, in terms of prevalence of the antimicrobial surveillance, where Dr. Celia, Dr. Federico Sumaya, and Dr. Pedro Saturno participated, they found that antimicrobials were the antibiotics is the most prescribed antimicrobials in these hospitals, and third generation cephalosporins or carbapenems were highly prescribed. The use of antibiotics was based on empirical decisions. No hospital had formal reference guidelines to prescribe antibiotics, and no data were found on the how to treat or to go over the treatment. Also, they detected that around 60% of antibiotics prescribed were grouped in 4 groups: third generation cephalosporins, gabapeptides, and broad spectrum lactamases. And they also found E. coli strains, at least 2 pathogens from the escape group, Klebsiella, Salmonella, others. And these strains were resistant to carbapenems and lactobactams. Also, the resistant pathogens were found in the 4 hospitals analyzed, and this becomes a serious issue that goes to show the importance of the bacteria resistant associated to healthcare. Also, a transversal design was carried out to collect wastewaters in outflowing from the hospital, and also sampling of the wastewaters after the water going through the different wastewater treatment steps. On the one hand, the wastewaters were analyzed to make the phenotypic determination of the escape bacteria and the genotyping of the escape group bacteria, as well as the total DNA samples collected from both systems. For the phenotyping, the raw water and treated water samples from effluent were treated by using chromogenic methods that were specific to the escape species in order to determine or to isolate bacteria from the escape group, presumptively that later were confirmed through BiPEP and also the Malitop system. So this way we can identify the genre and their bacterial susceptibility of these microorganisms. Also, the wastewater samples of raw untreated water were processed in order to obtain the DNA that we would have in enough quantity and quality for further analysis. That would be the metagenomic analysis, and also for the mass genome sequencing of those strains that we thought were significant based on their resistance and persistence and permanence in the wastewater treatment plants. The first outcome of this first phase led us to this paper, where surveillance of antimicrobial resistance is conducted in hospital wastewaters, and identification of carbapenemase producing Klebsiellas. The results showed that high rates of Klebsiella, cephalosporin and carbapenem-resistant Klebsiella, and these rates were observed in isolates of wastewaters that were both treated and non-treated in both hospitals studied. Also, they detected the presence of BLACA-PC gene causing resistance in these microorganisms, and the minimum inhibitory concentrations found in the carbapenem-resistant strains were more than 8 micrograms to 16 micrograms per milliliter. Also, in these samples, electrophoresis analysis were made in pulse fields, detecting 19 pulse field patterns in Klebsiella, SPP, Klebsiella, Epsitoca, and pneumonia in 4 isolates. Specific patterns of these strains were present both in incoming water as well as in the outgoing water of wastewaters. It's speaking about the potential that these microorganisms have in order to survive the wastewater treatment plants. A second work of this project was just recently presented, analyzing the phenotypic properties of the Acinetobacter, Enterobacter, and E. coli strains, where they found some beta-lactamate and carbapenem resistant strains and the presence of BLACA-PC gene and BLAST-CTXL gene. In terms of the genotyping, we detected through electrophoresis in pulse fields 19 different patterns in E. coli strains. These 19 patterns, some of them came from resistant strains that were in the outgoing water of treated wastewater. Particularly, I'm showing you the results of Acinetobacter baumannii. We detected 4 strains of Acinetobacter hemolyticus, all of them creating one single clone. This is clone A, which is present in treated water. This goes to show the capacity that this microorganism has to survive the treatment systems. As preliminary conclusions of this study, I must say that there is an excess use of broad spectrum antibiotics in tertiary care hospitals. This is limited to the documentation, to the reasons of the use of these drugs. We need to have some treatment guidelines for antibiotics. There's no antibiotic management system in these hospitals. We identified multi-drug resistant bacteria in the 4 hospitals that were analyzed. We saw the capacity of bacteria to survive the wastewater treatment plants and to persist and to shed to other environments. And also we detected isolates of Klebsiella, E. coli, and other multi-drug resistant bacteria that account for a real problem for public health, given the capacity that these microorganisms have in order to shed both bacteria and their genes. As conclusion, we will see that due to the quick propagation of these drugs in the ecosystems, epidemiological surveillance gives us the possibility to monitor the persistence and propagation of antimicrobial resistant bacteria, not just in hospitals, but also in other settings where we have the convergence of residues such as wastewaters. As perspective of this study, we need to conduct mass sequencing of multi-drug resistant isolates that had the same clones or different clones that were in the incoming and outgoing waters to make the metagenomic analysis to know the bacteria populations present in those samples and to analyze the resistome and virome of the multi-drug resistant microorganisms. General conclusions: it is critical to have an antibiotic management system at the hospitals in our country. It is also indispensable to have microbial resistance surveillance programs. We need to monitor wastewaters and wastewater treatment plants. That can become an important tool to survey antimicrobial resistance in hospitals and also at the community, because let us remember that wastewaters get to the community, as well as to have early detection of the resistant genes in order as part of the antibiotic classification by the WHO. This is the Access Watch of Reserve Antibiotics. I would like to thank the opportunity you gave me to be here. I would like to thank the group of Dr. Celia Alpuche that I belong to, and the opportunity of Dr. Celia, that Dr. Celia gave me to present this paper, and I'm thankful for being part of her group. Thank you.
Muchas gracias, doctora María Elena. Entonces,
Thank you. I will stop sharing. Thank you. Thank you. I will now share my screen.
no sé si ya la estén viendo.
Sí, correcto. Te vemos y oímos bien, Julio.
Sí,
Gracias.
doctor, se ve bien.
Yes,
Gracias.
we can see your screen.
Bueno, en estos casos nacionales,
In these national case studies,
a diferencia de otros países en
as a different from other Latin American countries, we have made effort trying to show what has been done in area of resistance, as well as what we have done through monitoring of SARS-CoV-2. Here I'll be presenting this second case, SARS-CoV-2, and therefore I belong to the Engineering Institute of UNAM. And I started developing these line as indicators in wastewaters, starting with antibiotics, and recently by analyzing SARS-CoV-2. We have mainly analyzed different contexts for monitoring the design of sensors that can assist to environmental area and the control of antibiotics resistance. And here I'm referring to the design of the system of treating of emerging waters, which is economical, that can help us to better control the and resistance to antibiotics through wastewaters. In the area of monitoring, for example, we started with the monitoring of SARS-CoV-2. We started a pilot project in May of 2020, having the support of the Water Council in Querétaro. And at that time, we had a close consultancy from the epidemiological institution of the state. They asked us to carry out a pilot test, and this is what we have on the left side of the screen, where we started analyzing the effluent of hospitals or sewage systems of hospitals. Some offices of that same water commission or board, only hospitals at that time had very sick people, and that was in 2020. And also we have a quarantine center where we were having people that were recovering, and also a social prison where in theory there were no people that were infected. And since May, we started carrying out a monitoring of effluents in this wastewater treatment plant in the northern part, close to our campus, and one that serves 300,000 inhabitants, which is less than half of the total population of the city. Another time, we also analyzed different methods of concentration and also of analysis of RNA. And we use a very simple method, which is an adsorption through electronegative membrane, and another one, which was a centrifugal ultrafiltration, along with some colleagues from Europe. And the advantages and disadvantages of each system that we identified for SARS-CoV-2, in the case of the electronegative membrane absorption, we didn't need to have specialized equipment. It represents low-cost equipment. And the disadvantages is that it has amounts of RNA, and of course, there's a potential inhibition of the RT-qPCR reaction. And on the other hand, the centrifugal ultrafiltering has a high purity of RNA, but also disadvantages. It requires high volumes of water. We need to have ultracentrifugal equipment and also these membranes that represent high cost versus the electronegative membranes. And in this pilot program that we had here in January, we see the treatment plans in blue, and in white we have the sampling points of the test that was required by the epidemiological center of the state. We did the monitoring, and in July of 2020, in this case, in the case of sampling points, and we found out that through the electronegative membrane, we had higher, or we identified and quantified higher concentrations of copies of SARS-CoV-2 versus ultrafiltering. And even with ultrafiltering, we had negative results, while with membrane, we almost always had a positive result. Something interesting in here is that in that prison center, we found positive values, even though they were not reported. In 2 weeks after we found out this in the sewage system, then those cases in this prison, state prison, these cases were reported. In the case of hospitals and as well as in the quarantine center, we obtained positive results. And because of that, since March of 2020, we started with our monitoring with certain frequency for different genes with SARS-CoV-2. And yes, we found that there was a correlation of the increase that we had at the beginning of the pandemic in Mexico, and also the increase of active and accumulated cases, and also an increase of concentrations of the virus in the stream of wastewater treatment plants. But we didn't find copies of that virus in the effluent, and that was something that we wanted to double check through the water board and in the epidemiological office. And also we analyze active sludges, and we can see that that was amount almost was constant, which showed that there could be an accumulation of these particles in solid matter. In 2021, we continue with the monitoring with this data, also with the 2 wastewater plants in the city. And these data are correlated because, or with the different waves that we had, and also with the new outbreaks of the disease, and also the rain season that are well marked and made a difference in the region where we live. Which other studies or pilot tests we have had in Mexico? Well, are the ones that we show here on the map so far that we know, and due to the collaborations that we have had, are the ones that are presented on the map. We are located here in Querétaro, and due to the high variance that we have in Mexico, we have different sizes of population and weather. In Querétaro, we have 1.2 million, and we also work with Mexico City, which is a city with almost 9.2 million inhabitants, and with some other universities, by setting up a monitoring system for the pilot, and especially by increasing the capacity based to the needs of such a large city. And also worth mentioning that we have also worked with Cancun. It is very interesting and specific because they have high migration because of tourism activity. And also to emphasize that, as far as I know, there is only 1 case where they carry out constant monitoring, but operated by another entity. But in our case, the academia is in charge of this pilot. Since we are the engineering institute, something we're interested in is to solve problems. And in this case, there is a strong contribution with electrochemical. Dr. Ramirez Chavarria, who is a main inventor of this electrochemical sensor, based with loop-mediated isothermal amplification and with different genes and ORF of a SARS-CoV-2 virus, and they develop different reactions based on colors, and to see what was the increase of the potential when they detected this virus in the same samples that I show you from RNA samples of Querétaro. But the most interesting thing is that as the sample dilutes itself, we find different behaviors in the potential that is detected. And for molecular chemists, we can see that this is quantitative PCR. So what we're doing here is to validate the quantification of the virus, in this case SARS-CoV-2, with an electrochemical low-cost system. And this is an isothermal amplification. Therefore, this can be carried out simply inside. So the idea is for these to be done in labs, even of wastewater treatment plants, without the need to go to specialized labs. As a conclusion, I would like to say something that we already know. Epidemiology based on wastewaters has the potential to reflect what has been the dispersion of SARS-CoV-2 virus in the population. And the constraint is that it is not linked to the health sector, at least in the state and some others. And when the pandemic started, the health sector had its own epidemiological system based on statistics. Therefore, they didn't see the use of this system. They didn't thought that it was useful, and so far they don't think it is useful. So the perspective is to implement low-cost devices that can make a massive use of these wastewater-based epidemiology. Thank you very much. Thank you, Julian, for your presentation. Thank you so much. And also Dr. Velázquez for her presentation. Quite interesting to listen both presentations. Thank you. We will continue now with the national experience of wastewater in the case study of Chile. And now I would like to introduce Doctors Aldo Gallero. Aldo Gallero works in environmental hydrology with the program of hydrology of biomedical sciences in the School of Medicine in the University of Chile. And also he is representative of the consortium of University Lab for Wastewaters. And also Dr. Jorge Olivares Pacheco, working with the group of antimicrobial resistant bacteria of the Biology Institute of the Universidad Católica, and also is part of the group of labs of wastewaters. We cordially welcome you both, and we want to thank you for joining us today.
Thank you, Pablo. Am I authorized to share the screen? Can I share the screen? No. Can you please authorize me? You are a co-host. You could share your screen.
No me permite.
I can't.
¿Puedes? Había un setting que acabo de modificar. Dime si ya
I
puedes.
just changed the setting. Let me know if you can now share your screen.
No.
No.
Qué raro.
That's weird.
Si deseas, a ver, déjame ver si lo puedo compartir. ¿Qué te parece si te voy a pasar por acá? ¿Me puedes pasar tu presentación y yo
Can
la
you
proyecto?
send me your presentation and then I will be able to share it? But it's a bit weird that you cannot share. Because this is enabled for all participants.
Los temas de la tecnología, ¿no?
This is a technology
Sí, Aldo,
issue.
avanzar porque el
Yes.
tiempo apremia.
To move on, because we don't have much time. In the meantime,
¿Podrías pasarme por acá? No sé si
perhaps
puedes compartir el archivo por acá,
you
la
can
presentación y yo la
send me
o
the
si no,
file
te
so that I
contesto
can
un
share
correo.
it or email it to me.
Si no, te paso mi correo y también te paso.
I can give you my email.
Ay, ay, ay.
A ver, qué raro que no se pueda.
It's very strange that you can't share your screen.
Ahora sí estoy de confitrión, pero no me
I
dice que
am
soy confitrión, pero
Co-host, yet I cannot share the presentation.
Ah, qué tontera.
A ver.
Lo otro que podemos hacer por
Something
mientras,
else we can do in the meantime,
somos dos presentadores,
since we are two speakers, maybe Jorge Olivares can start. In the meantime, I can sort this out. So do you think he can start?
Jorge, ¿tú podrías presentar por mientras?
Jorge,
Vale.
can you just start now?
Ve si puedes,
Let's see if you can share your screen.
¿Puedo compartir? Sí. ¿Están viendo mi...?
Listo, ahí se ve Jorge.
Okay,
Ah, perfecto.
we can see it and we can hear you.
Hola, ¿qué tal?
Hello,
Muy buenos días, muy buenas tardes.
good morning, good afternoon.
Diferentes ciudades de
In the different cities
Muchas gracias por la
of Latin America. First, thanks for having me here.
de la importancia que nosotros hemos logrado
Aldo was going to talk about the importance
de haber formado un consorcio en
of
diferentes regiones
creating a consortium in different areas of the country to measure
donde hemos medido la concentración del virus SARS-CoV-2 en las aguas residuales.
SARS-CoV-2 concentration in wastewaters.
De cierta forma,
This started
nosotros con la profesora Adel de la Universidad Andrés Bello nos adjudicamos un proyecto hace un tiempo atrás
where we started working on this
para medir
project
el virus
in order to
SARS-CoV-2
measure SARS-CoV-2 in wastewaters
de Santiago, cuyo
in the
resultado
city of
pero
Santiago.
nosotros teníamos una
We had some previous background. For some time, we had been working in antimicrobial resistance in wastewaters and water bodies. Something I wanted to do with this presentation, and one of the big questions is to find resistance markers in wastewaters and water systems. Yesterday and today, we've seen that several presentations, unlike what has happened with SARS-CoV-2, which is a very unique pathogen, many of us are looking for several elements in wastewaters. But it is difficult to establish some criteria, or it's difficult to start surveillance. I think that we should set up some criteria to know what to look for in those wastewaters. It is important to say that in wastewaters, we can find three types of contaminants, or in the different water systems, we can find three types of contaminants. We may find chemical contaminants, antibiotics that we can measure in water systems, also the resistant genes and resistant bacteria. If we were able to set up a hierarchy or to type the hazardous levels, the resistant genes are the most important ones, the most hazardous, because they can really spread easily. You know, the resistant genes are the most hazardous of all. So here, I'm thinking about water systems. In research, we have classified 3 types of water systems that we need to focus on because antimicrobial resistant impacts on them. One is freshwater bodies, where apparently we have low levels of antibiotics. The problem of wastewaters, where we have high concentrations of antimicrobials because of the wastewaters from the community and the hospitals, and also agriculture. This is in fresh water and salty water. I will be talking about the first 2 and how we can really impact. It is true that wastewaters are water systems that are dynamic, are complex with a high biological and nutrient load. So it is difficult to study wastewaters for that reason. Wastewaters are an important source of information as well, because all the wastes of human activity end up in wastewaters. So technically we can measure anything in wastewaters from any population or territory. And as you can see in red, wastewaters is a source of information about pathogens and contaminants of a certain territory. But one of the big questions, a big question to understand the antimicrobial resistance phenomenon is what to look for. What shall we look for? What element can be the sentinel element? What can be the main element to follow? Which one can be the resistance marker? What element can give us a big scope? Well, we can look for the antibiotic, or we can look for bacteria, or we can try to find genes. This is one of the big questions in the mind of all researchers, and we need to sit and discuss to define the criteria to see and say what we are looking for in wastewaters. So this is the question: are we trying to find genes, bacteria? Are we trying to find the antibiotic in wastewaters? What are we looking for in wastewaters? We have made some progress. I'm going to present a bit of what we've done in superficial waters, and I will be speaking about a mega study where we include several elements. So one of the first things we did was to try to find genes. Where did we look for genes? Well, here you can see 3 rivers in the Mediterranean area of Chile: Chaupa, Maipo, Maule. All of them have different activities. The Chaupa River is heavily influenced by mining activity. It's been described that there are heavy metal resistance in Maipo River is where we have the wastewaters from Santiago flow into there. And the Maule, this is a river where we find agricultural wastes like disinfectants, herbicides. Also here we see also some antibiotic resistant antibacteria. This is measured on pQCR. Here we see different antibiotic resistant genes. So we try to find beta-lactamases, also resistance to tetracycline, also integrin resistant bacteria or heavy metal resistant bacteria. We have studied these bacteria, and we can see, as you can observe in this image, that in blue we see the Chaupa River, the Maipe, and the Maule River, and with this is a correlationship. Those areas that are impacted by mining, in those areas, we high important presence of heavy metal resistant genes. In the Maipo River, for example, in orange, this is smaller. There's no heavy metals. There's more urban influence, and this goes to show that we can use these markers in superficial waters as an important source of information. On looking at this panel of the different genes, we can see how they move, how beta-lactamases move. They are dominating in the Maipo River because of the urban influence, but the level drops in other rivers where there's no urban presence. And the GenT1 gene that has been defined as an important marker of antimicrobial resistance. This is a very prevalent gene, and this gene could be a decoy or sentinel resistant gene, and we could use this gene in order to carry out some monitoring work. After defining this gene panel, which is a bit arbitrary, what happens if we try to find bacteria? We characterized a big amount of antibiotic-resistant bacteria in the Aconcagua River. The Aconcagua River is a river that goes through several medium-sized cities in Chile. It goes through Valparaiso, that has 2 million inhabitants. And it is important to say that we collected 1 liter of water. We filtered the water through a 022 filter, and we placed that water in different culture media at different temperatures to try to grow bacteria, as many bacteria as possible. Here we see the different points in the map. We did the sampling at a seasonal level, and so during different months of the year, and we determined the prevalence of antibiotic resistant bacteria. This is during the entire year, and we see that such resistance varies over time. These are the factors that have an influence, and as we will see later, these factors also have an influence on wastewaters, the wastewaters that we measure. So we came up with 7 isolates at 37 degrees. There are many resistant bacteria under 37 degrees. These are the reservoirs of this bacteria, and these are the bacteria that grow at 37 degrees that could become potential pathogens that could harm animals and humans. If we think about wastewaters and we try to find genes and bacteria, well, we carried out a more ambitious project. We wanted to see in a city in Chile, we wanted to see the potential contaminants or the potential factors that would whereby bacteria will be shed. And in order to do that, we used a platform. This is a very potent platform. In a city of Chile that has around 50,000 inhabitants, we have given follow-up a cohort of 10,000 people for 10 years. Almost 20% of the population has been followed up for 10 years in many areas and aspects. And we measured in this small city, we measured different aspects. We measured the incidence of the antibiotic-resistant bacteria in the inhabitants of the city. Both inhabitants, we gave follow-up to people at hospitals or in the community. This is, we wanted to see the prevalence of these antibiotic resistance bacteria. We also measure the prevalence in rivers. Rivers flow around the cities. We saw what happened at the wastewater treatment plant. And we also measured bacteria in drinking water. This is, we tried to include all the potential elements through which people may get these antibiotic resistant bacteria and through which they can also shed them. Also, we went to the vegetable selling points. Many vegetables are not cooked, like lettuce, for example, and we looked at those vegetables or fresh produce that had some bacteria. We tried to understand the resistance phenomena. This is starting from people going through fresh produce, drinking water, wastewaters, and superficial waters that may be around these cities. So we came across with many resistant bacteria. This is what we found at the wastewater treatment plant. We also measured over 2 years. We took seasonal samplings, and we came across with a high prevalence of beta-lactam resistant bacteria or beta-lactam or beta-lactamase inhibitor resistant bacteria. So, you know, this was a big surprise because this is something that we also found in people that were the carriers of these bacteria. We also found these bacteria in people that have ended up in hospital that had caught the bacteria. And what's most important, the most impressive thing we found is that we also found these bacteria in drinking water. This is the potential way in which an antibiotic resistant bacteria, the way that people caught these bacteria is through drinking water. We detected this bacteria through some smears, and we saw that the way bacteria ended up in humans was through drinking water. It is impressive to see the amount of multi-resistant bacteria that we have found. And after the full screening of all of these elements, of all of these systems, what we tried to do was to do the genome sequencing. We sequenced genomes. Today, we have more than 400 genomes sequenced, and we were able to draw how these bacteria end up in people, how people also release bacteria into the environment, and how bacteria shed. These are the antibiotic resistant bacteria, and this is the shedding of them. And this is something we found in the resistant genome. And just to try to wrap up, I must say that the question is still open. Are we trying to find genes? Are we trying to find bacteria? Are we using real-time PCR? This depends upon the possibility of each country. After many studies in different cities, E. coli, cephalosporin resistant E. coli could be a good marker. And this is what we found most in many systems. Also the class 1 integrons, could they become a big marker? Could we make surveillance with 2 compound markers? Do we isolate bacteria genes? This is one of the big questions that we have. And also wastewater in the ideal platform to try to define the resistance. Thank you for giving me the chance to make this presentation, and I hope Aldo will be able to make his presentation. Thank you. I hope. Stop sharing to see if I can share. I tried to fix this, and I don't know whether I will be able to share my screen or not.
Can you let us know if you're able to share your screen? I've never had problems to share my screen in the past. I don't know what's going on. I'm not able to share my screen. Something's going on, Pablo. Sorry for that. Okay, this is technology. I don't know if we can keep on going with the agenda while I try to figure out how to solve this problem. And if there's some time during today's program, then I would make my presentation later on. So I think now we can move to the Q&A session. Yes, please go ahead, Pablo. And in the meantime, we'll find out if we can solve this. If not, Aldo, if you can send your presentation through us via email, and then we can give you time after the case of Argentina. Okay, so I'll try to do that. Sorry for these technical issues. Thank you to you, Aldo. Very well then. So and now listening to these different case studies and looking the perspectives of different countries, we can start with some of the questions that we have that have been presented by the audience in the chat. Monica, you have the floor so that you can, yes, I will be making this question in English.
3 questions for you. The first one is if you could please clarify what parameter you use to assess the effect of rainfall on RNA signal.
Hi.
Hi.
Is that for Renee? So I'm just trying to turn on
Yes,
video?
that's for you. So
Okay.
they were wondering how you, I guess, normalize, or what parameter you use to assess the effect of rainfall, of rainfall contribution to the RNA signal.
Okay. Yeah, good question. At the moment, we don't have a way to assess this. So we just make very detailed field notes as we go along, and always just, check back with our field notes and our data if it's making sense. Yeah, and this is a way we have been doing it for the last 2 years. We do have places where we have, we have a diverse country, so we have rainy seasons in certain areas where it's the opposite in the, the summer rain and the winter rain. We take it into consideration when we're interpreting the data, but yeah, we don't have a way forward to control for it, although we'd like to. Thank you.
Nice. Thank you. There is another question: is how many? And this is a good one, actually. I also wondered how many samples per week do you analyze per site, and how many samples do you think are needed? I guess to have a good a good analysis.
So how many samples per week? Was that the question?
Yeah, for the site, I'm guessing it's not set here, but I understand it's for the site, meaning monitoring points, right?
So we monitor about, at the moment, it's about between 75 and 80 a week, every week. So I was surprised to see Jazz did up to, nearly 500 a week. So yeah, for us, 80 samples per week, every week keeps us very busy. And that's across the 6 out of the 9 provinces in South Africa.
Yeah, so per site, so if I understood right, you're monitoring one site per week, but you have so many sites that you monitor that many samples, right?
Yeah, that's right. So each site is a wastewater treatment plant. So we monitor over 70 wastewater treatment plants. We collect on the Monday, and yeah, every Monday throughout the year from those same sites.
Thank you. And the last question is, which population is covered by WBE, wastewater-based epidemiology, in South Africa? So which populations are you targeting?
Oh, also we do mostly urban centers, and it also depends on where the university is based that we work with. So most are urban settings, and we'll do the entire urban area usually, and there can be between 8 to 12 wastewater treatment plants in an urban area. For example, in the city of Cape Town, we do all 24. So it does depend, yeah. But we also, that's just our main monitoring. We also do university campus monitoring, which I didn't manage to present. And we are now working with the Kruger National Park to monitor the rivers and streams, because they were affected quite a lot by their tourism was affected by COVID. So we also do other environmental monitoring, so not just the wastewater treatment plants.
Thank you, Renee. Thank you very much.
Sure.
And now I share the hosting to Pablo for the other questions. Thank you.
Sure.
Thank you. Gracias, Juanita. Okay, entonces para continuar con los...
To continue with our questions for Dr. Velázquez, we have the following questions. You're talking about hospital and homes that have results of antibiotic resistance. And the participant is asking, said that the farms have more importance than those. Are there studies of the ones that contribute more to antibiotic resistance or not? Well, not specifically, we don't have this kind of studies. In fact, Dr. Alpuche, before this study of wastewaters, she carried out another study of pig farms looking for bacteria that are resistant to antibiotic, and to relay that to the populations that are nearby and that had some diarrhea cases, but to have specific data that it is known which are the ones that contribute more to these antimicrobial resistance, not. And as we said in the study, we need to have monitoring that will reflect the real situation of antimicrobial resistance, and not only through wastewater, but also through agriculture in general, to include hospitals where they have worked more about that. But having different groups, having independent information for those groups, but not, we don't have like a national database, but still that information is valuable. So including all those parts, that would be the concept of health, where all systems would be represented, and then we would realize who contribute more to that resistance. Thank you, Doctor. To move forward with our questions, this question is for Julian. We have some other questions. Which is the limit of detection of the LAM technique versus qPCR, and what is the cost of those two? This is with the one we have been working with, RT-LAM. Actually, we have only tested with the sensor, therefore we have not validated the quantification itself. We're working on that comparison now related to the limits of detection. But in theory, RT-LAM is more economical. But I would say the cost is not too different based on reaction, but the cost of material changes. But the decrease actually processing is quite different. And also the need of more staff, expert in molecular biology. In RT-LAM is not that required. Therefore, we are considering that any analyst that hasn't too much experience can do it in a treatment plant lab. And that will decrease cost, at least in our cases of qPCR. 50% is represented by the staff because it's highly specialized staff. So this technique would be, or would mean that other people could carry out that analysis, and you don't need to have a thermocycler, which is quite expensive. And also we are looking at also simple RNA extractions that do not require to have specialized equipment. Therefore, investment of capital is quite low. Thank you, Doctor. We have a couple of questions more for Dr. Olivares. Is there any initiative to update the Chilean regulation for drinking water and wastewater, and also if it's recommendable to have a sequence of wastewater as a first close-up to the view of what it is antimicrobial resistance? Well, thank you for your questions. The first question is a wonderful one, because I think there's a global problem to know what it is the standard of water quality, the one that comes up from a treatment plant, as well from drinking water. And in most of our countries, and we made a thorough analysis, most of them ask to have a certain amount of fecal coliforms that could be 0, which is required in drinking water in Chile and in most Latin American and European countries. But they forget about the rest of pathogens and the wide things that are not considered to be coliforms and that are present, and that we have seen and detected in different cities of Chile. Even though drinking water, they don't have these coliforms, they have some other pathogens. So it even more flexible is the standard concerning of water that has been treated already. And I think that Julian also somehow mentioned that we need to move into other treatment systems of wastewater, therefore to change the standard. It's not only to say that it will have a certain amount of coliforms, but also we need to measure other parameters. Even in some other countries, chemical parameters are not being measured, or that they are not eliminated with a treatment because it's a biological treatment to eliminate bioorganisms. And so we are at the sake that these pathogens will go to different streams, and therefore we have this vicious cycle where these viruses that are resistant are present once more. And this is something that we were able to prove in this small city in Chile, which was a true lab, an outdoor or open lab on how these microbial resistant bacteria work. Related to the second question, when looking also wastewaters, as I always said, that wastewater is a complete genetic soup. There are thousands of things present there. Yes, and it's a good approach. But I think that this is a discussion that we as scientists must have to know what are we measuring, if we're measuring DNA or to measure virus or protozoa or some other pathogens in wastewaters to look at their genetic material. I think that could be a quite interesting event and feasible. But to isolate bacteria and to characterize them, to look at their phenotype, or to do something deeper, trying to find out their phenotype and genotype, then we will have a powerful predictive and measuring tool. Thank you, Dr. Olivares. In this way, we close the question and answer session, and we close session 3. I want to thank you all, and now I would like to give the floor to Monica. Thank you to all the speakers and all the participants for joining us. And now we will give the floor to Julian and Marcos to start with session number 4. Thank you so much.
Gracias, Mónica.
Muchas gracias, Mónica. No sé si me veis, pero bueno, si no podemos seguir con la sesión. Vamos a seguir con los casos. En este caso vamos a pasar a Brasil, donde vamos a tener a la doctora...
We will move on to Brazil with Dr. Mariana Stenoli. She's a bio doctor, master in science, and she's been working in the area of São Paulo for more than 40 years in environmental analysis, coordinating research projects in monitoring of chemical pathogens. Dr. Mariana Stenori, she's an important member of the Panacea Network, and she will talk today about her experience in Brazil. And with Mariana Stenoli, we will also have Renata Imbrunini. She's the general coordinator of the Health Public Laboratories and Secretary of Surveillance in São Paulo. Please be welcome. Go ahead.
Marianés, ¿me escuchas?
Marianés, can you hear me?
Julián, ¿tú me
Marcos?
escuchas?
Sí,
Can you hear me? Yes, can you see my presentation? Yes, we can.
¿Puede verla?
Can you see it? Yes, we can.
Desculpe, preciso volver para lo primo slide.
I needed to go back to the first slide.
Desculpe. Então, graças, Marcos, é uma satisfação.
Thank you. It is my pleasure to take part in this session. I would like to thank you for the opportunity you gave me to talk about the work we are conducting in environmental surveillance of pathogens in wastewaters and the initiatives and the use of these tools in our country for detecting COVID-19. I work in the Sao Paulo Department of Environmental Analysis. We've been working in wastewaters for some time, since 1970. In 1978, we were able to isolate a vibrio cholera strain from the sewage in Santos City. That was an object of international studies. And we showed pathogenicity, and that led to the development of the cholera vaccine. We cannot see the presentation, we just see the last slide. I think you need to stop sharing and then share again. Oh, my apologies. I don't know what's going on. I need to have the authorization from the host, or you're gonna get the authorization so that you can share your screen. I see a message that reads that only the host can share. I cannot share. Yeah, you can share. The thing is that we were not able to see the entire presentation. We were just looking at the last slide. I am trying to share my presentation. Can you see it now? No, no. Julian, have you got my presentation? I don't know why I can't.
Share the screen.
Share your screen. Now I think it will work. Yes. Okay, there it is.
Sí.
All right, so I cannot see the presentation in full screen. Hit the presentation button. Can't you see it in the full screen? No. Julian, it's better that you share the presentation. I don't know what's going on. I cannot see it in the full screen. Or the other choice is that you will be passing slide by slide as you wish. You want me to show it for you? Yes, it's better if you share it for me. All right. Oh, and excuse me. No problem. Can you see it now? Yes, now we do. Just let me know when to change slides. Next one, please. So, as I was telling you, since 1978, we isolated a Vibrio cholera strain in the Santos region. This was a subject of international studies because this showed the pathogenicity, and this led to the approval of the cholera vaccine. From 1991 to 1999, Latin America was hit by the cholera pandemic. So this tool was very useful to detect Vibrio cholera coming into the state and also to determine the risk areas. With regards to polio, we started to monitor the virus in the environment in 1980, before the eradication of polio in the country that took place in 1994. Since 1999, we've been developing an environmental surveillance program as part of the initiative of World Poliomyelitis Eradication, together with the Health Secretariat of the state of Sao Paulo. And we also started to look at the incoming of poliomyelitis in the endemic areas. We Also saw the autochthonous or imported strains, and also we developed the trivalent vaccine against poliomyelitis, and also the bivalent that includes serotypes 1 and 3. In 2014, next one, in 2014, when the soccer World Cup took place in Brazil, we were able to isolate type 1 at the Viracopos International Airport in the state of Sao Paulo. And this was poliovirus, and poliovirus type 2 that led to the vaccine development in the port of San Sebastián in the Sao Paulo coastline. This showed the effectiveness of this program in environmental monitoring of these pathogens. Next one, please. This is a paper dealing with this. Next one. With respect to coronavirus, COVID-19, the first case of COVID-19 was notified in the city of Sao Paulo by the end of February 2020. This was reported by the group of Professor Medema in the RNA COVID detection efforts, and this showed that surveillance of wastewaters was also a sensitive tool to evaluate SARS-CoV-2 circulation in the community, and also to look at the COVID infection trends. Therefore, preparations were made to make SARS-CoV-2 analysis in wastewaters by using the experience we had from other pathogens. Also, monitoring started in April 2 years ago by sampling the 4 major wastewater treatment plants in the greater São Paulo region that includes more than 50% of the population of the state. This is where most of cases were at. Also, there is a dam where the wastewaters come after they've been treated. Also, we expanded monitoring in the city of Sao Paulo, including 2 areas of the cities, 2 of the favelas in the cities. Another monitoring was carried out in other regions. And by the end of August and early September, the monitoring expanded to superficial waters of the rivers that cross the metropolitan area of Sao Paulo. In October, we started monitoring waters from a public and a private hospital. In February and May 2021, we started monitoring wastewaters of 2 cities that had mass floodings: Serrana with Coronapac and Protopactu with because of AstraZeneca, Botucatu. In 2021, considering the low immunization rates in the state of Sao Paulo, we assessed the monitoring points, and we included the entry points, airports, ports, bus stations. And the results we obtained from monitoring were taken to the epidemiological surveillance centers. This information is available on the website. The website shows sample points, methodology, and the evolution of the SARS concentrations at each sampling point. We are putting together this website, developing cross information from different epidemiological points. I would like to talk about the Brazilian initiatives. This slide shows the evolution of SARS-CoV-2 concentrations in wastewaters in the Serrana city that went through immunization. The first dose was in February, the second dose in March, and they ended up the first phase of immunization in April. And so the booster was in September of 2021. And so what we can see is that immunization in the first and two dose, here we see cases, concentrations. So these values had a huge fluctuation. We have in January 2022, we have many cases due to Omicron. However, it's interesting to look at the figure to the right, where we have the cases where the virus came in. And it is important to see that after immunization, at the end of April, the cases that were notified were fewer. We don't really have hospitalizations of these people. It is also important to see the graph because we can see that the rates of the burden in wastewaters are high all the time because of asymptomatic cases. Besides that, in Brazil, we also have other initiatives to have environmental monitoring for epidemiological surveillance. We also have a group of virologists, environmental virologists, that for a long time were monitoring wastewaters, fresh superficial waters, wastewaters and water systems. And they also started to monitor SARS-CoV-2 in wastewaters of the region. This group is focused on the southern region and southeast of the country, have evaluated circulation of SARS-CoV-2 in Espírito Santo, Niterói, Victoria, Santa Catarina, Florianópolis, and also inside the state of Santa Catarina, in the different regions in the south. Also, sanitation companies, environmental companies participate, as well as the state municipal health secretariats. All of them participated. And this is the results of the monitoring. These are the health agencies. This information is made available on websites. And here we can see, as Dr. Tatiana will tell us, this is where we can on this graph, we can follow the evolution in time of viral concentration and also the heat waves also and the viral concentrations. And this next slide is interesting because this is the experience of Porto Alegre. This information is available on Twitter. This is to provide access to the entire population. This is another initiative. The COVID Monitoring Network Project for Wastewaters has a technical coordination of the Minas Gerais Technical University. This brochure includes 5 states and the federal district. It covers 4 regions of the country. This network is under the coordination of the National Institute of Science and Technology and also wastewater treatment plants, and also the National Agency of Water and Sanitation with the support of the National Council of Scientific and Technological Development. The monitoring is carried out by the federal universities with the support of the sanitation offices of each municipality. So these are the results that are reported through a bulletin and through this dynamic scheme where we see the behavior of the virus and the epidemiological data such as beds, occupied beds, and hospitalizations. And finally, we have another group that is part of the network of the Ministry of Science and Technology, and they took action. And this is focused on 3 areas: in the metropolitan area of Sao Paulo, in the Guyana municipality, and also the Foz do Iguaçu in Paraná, where we have the Itaipu office. These are the results that are published weekly, as well as the viral load variation in time. Here we see also the viral concentrations in wastewaters, as you can see on the left slide. So the result of all of those initiatives in Brazil is that now all the regions in the country are included for monitoring, with the exception of the northern region of the country, where we don't have any environmental monitoring. Here we have the lowest sanitation rates. In the north, we have the most vulnerable population. What these initiatives of wastewater-based epidemiology have shown is that all of these initiatives for SARS-CoV-2 in Brazil consolidate what we know about the tool to support epidemiological surveillance actions against COVID. This is an important alertness tool for detecting early SARS-CoV-2 in the population. It allows us to have an early assessment of the trends, evolution of cases. This is an important tool for active surveillance of SARS-CoV-2 circulation in vulnerable areas that require immediate actions to contain the propagation of the disease. SARS-CoV-2 positive samples haven't shown to be viable or ineffective until today. Positive samples have no relevant meaning for fecal-oral transmission. We have had a limited success in sequencing of SARS-CoV-2 variants in wastewater samples and superficial water samples, particularly in the case of new variants. And so this is a report of all the initiatives that we have conducted in Brazil. We have been able to do the sequencing on some samples. However, the amount is very small. And finally, perhaps most importantly, is the work, the need to have an integrated work in the health and sanitation system. So what are the challenges that we have today? It is very important. All of these initiatives in highly fragmented countries, the challenge is to integrate all the environmental surveillance groups and to have a national program with several actors coordinated by the Environmental Health Surveillance Agency. I spoke to the person in charge of environmental surveillance, and they're starting an initiative in order to establish a national program. The idea is not just to survey for SARS-CoV-2, but for other pathogens, and also to see the antimicrobial resistant pathogens. This is to carry all of this is an important challenge. We need to sensitize decision makers about the importance of incorporating environmental surveillance as an indicator to epidemiological surveillance. And as in the case of the UK, this is a global program. I believe that we all are more or less at the same level. We really need to make efforts to accomplish this. Another important point where we need to work on is in methodologies for environmental surveillance. We need to use these initiatives, but we also need to have some minimal technical criteria for follow-up in order to provide continuity. We need to optimize sequencing methodologies to detect the pool of variants in wastewaters. Now with the high immunization rates, now we need to see or look for other variants. The Panacea network is doing a good job together with the Karolinska Institute. They have supported us to do the sequencing of those samples. Also, it is important for the laboratories of environmental biology to strengthen. Also, the molecular biology laboratories, all types of laboratories need to become stronger so that this work can be disseminated. It is very important to ensure financial human resources for the consolidation and maintenance of environmental surveillance of SARS and other pathogens in wastewaters, including the antimicrobial resistance, because this is something we need to start working on. So this is a huge concern for us because some of those initiatives no longer work with the SARS environmental surveillance because we don't have financial resources. So I believe that the World Bank, it would be important for the World Bank to support us so that we won't lose the effort we've made. And the next two slides show some publications. These were the publications that came as a result of this surveillance work. A lot was published in the last 2 years. Here you can get more detailed information about the studies. Here you have information about our cases. At the beginning, we needed to work on the dissemination of methodologies, more sensitive methodologies, because we were used to working with non-enveloped viruses. So all of these works dealt with technical issues. And, you know, all of that really helped us implement all our initiatives. I would just like to thank you for the chance you gave me to be here with you regarding antibiotics. The Minas Gerais University is now undertaking some initiatives. Different groups are working on antimicrobial resistance. And in the environmental area, we're just starting. We've been working together with the School of Public Health and São Paulo University. We've been researching specific projects. So we don't yet have something perfectly structured. Now my colleague will give us more details as to what's happening with antimicrobial resistance. Thank you.
Olá, você me ouve, Marinês?
Sim.
Ok. Vem minha tela?
Sim,
Sim,
tá? Sim.
Ok.
Então, a resistência aos antimicrobianos é um dos maiores desafios de saúde pública, com
This is
impacto
one of the biggest health challenges, having the impact on human and animal health in order to prevent and to control resistance and to antibiotics. Brazil tackle the resistance of antimicrobials, and it was published.
Assim, o plano de ação nacional foi elaborado em convergência com os
And this was a national action plan that was working with the different with FAO and other organizations, and it was presented to show what it is, the antimicrobial resistance. This is to guarantee to give the capacity to prevent infection diseases with safe and effective medicines, to have guaranteed quality and to be responsibly used and prescribed, and for them to be affordable for those that might need them. Here we have 5 strategic objectives that will help us to raise awareness and to understand resistance of antimicrobials, also to strengthen knowledge and scientific baseline through surveillance and research, to reduce the incidence of infections by having effective sanitation, hygiene, and prevention of infections, to optimize antimicrobial medications in human and animal health, and to prepare economic arguments for sustainable investment, and to increase investment for new drugs, diagnosis, and vaccines, and also to have other interventions. Within the strategic object number 3, which is to decrease the infections incidence by having efficacious measures of sanitation, hygiene, and prevention of infections. The objective 8 is to expand the coverage of basic sanitation to prevent and to control infections. And the strategic intervention 8.1 is to strengthen the political policy and management of basic sanitation according to the National Sanitation Basic Plan. And as part of the activities to increase the percentage of municipalities to be part of the basic municipality sanitation plan by increasing the percentage of municipal services for basic sanitation, to increase the percentage of wastewaters that are collected, to increase the percentage of municipalities within the registry with a percentage of absence of E. coli. As a part of the challenges that we find due to the pandemic caused by COVID-19, some activities have been postponed. As part of this challenges, the Ministry of Health transferred 120 million to 27 central labs of public health. They restructured the technological park to buy equipment, extractors, PCR, automated equipment, and others. And in order to promote the early detection of resistant strains of importance within public health, to take action and to have timely decision-making processes. And also, as part of the perspective, we have the epidemiological analysis of the data to structure the response and to build up epidemiological publications and to state national governance. Therefore, the data obtained from environmental analysis surveys and of water are of importance to guide the actions of public health, and especially those actions to tackle the antimicrobial resistant bacteria. Thank you so much.
Renata, você só, eu acho que talvez fosse interessante.
This has been very interesting. Can you tell us more of the perspective of how to use these different tools for epidemiological surveillance, how the ministry is considering to work this area.
Se você puder depois me ajudar a traduzir, eu agradeço aí, Marinês. Bem, o Ministério, a perspectiva, né?
The perspective of this ministry is to retake several actions with the Ministry of the Environment, and a plan has been developed, and through that analysis
Nessa análise de águas residuais,
of wastewaters, therefore we understand which is the scenario that is present within Brazil.
Em relação, né, às ações da resistência, né, do que precisa ser
to see what needs it, or which are the actions that need to be implemented in Brazil.
De restabelecer novamente as discussões e essa governança.
Usually, this is what comes present as part of the discussions that we have for national governance.
Ayer la traducción simultánea estaba funcionando también en portugués.
Sí, sí, gracias. Gracias.
Muchas gracias, María Inés.
Thank you so much, Marinés, and thank you so much. I would like to give the floor to Julia now to present the case of Argentina. Thank you, Marcos. Now we will listen the case study of Argentina. And we have Dr. Verónica Beatriz Rajal and Francisco Garcia Campos, who will be presenting this case. I would like to mention the bio. Francisco Garcia is epidemiologist, expert in public health in charge of epidemiological surveillance. He has done field work with cases of population with zero prevalence of Chagra and outbreak of COVID and cholera. While Dr. Rajal, she's a chemical engineering professor in the engineering school of the Salta University and main researcher of CONICET. She leads the waters and soil area for the industrial chemistry and working on microbiology of water. And she has led the project of detection of CORB-Sub2 in surface water and wastewaters. Thank you. Now I would like to give you the floor.
Good morning. Can you see my screen? Yes. Can you just put it in presentation mode? Okay. There you go. Good morning, good afternoon, good evening to everybody. Today, I'm going to tell you about the work we have carried out in terms of SARS-CoV-2 surveillance in superficial and wastewaters in Salta, Argentina. This work has been possible thanks to the fact that at the beginning of the pandemic, we presented a project that was financed with national funds. This project was carried out in 1 year, 3 months, basically in our laboratory. This is the soil water laboratory that was revamped to detect SARS-CoV-2. This work, in this project, we worked with a group of the lava virology laboratory, and I'm going to tell you what we did in Salta. Many general objectives were present, but because of time considerations, I will just focus on the first objective, which was to conduct surveillance on SARS-CoV-2 infection at a mass population level based on wastewater study and superficial water study. During development of our project, we were lucky enough to interact very closely with different groups of the country that were carrying out similar activities. This was possible thanks to the federal network of COVID detection in wastewaters. This group was coordinated from the Ministry of the Nation. Right now, we all know about the importance of surveilling or monitoring wastewaters. I'm not going to be dwelling much on that. However, many of you might be wondering why did we also choose to study superficial waters? Well, here I must say that our laboratory has been working for 15 years on detection of different types of pathogens, viral pathogens and parasitic organisms in superficial waters. Our laboratory had started working on that, so that experience allowed us to know over time that wastewaters, insufficiently treated or non-treated wastewaters, as they are dumped in many countries, these waters are dumped in water bodies. These waters are dumped into rivers, and that water is used for different things. Population uses those waters. This is our work plan. This is how we did it in the lab. This is after sampling water. Superficial waters were characterized for further analysis. They were concentrated by using different technology. We did the RNA extraction, and then we made the quantification, real-time PCR quantification to look at the N gene, and by using the N1 system, and the results that we got were analyzed for different purposes. In case you are not familiar with our geography, I'm going to show you the map of Argentina. We see that the state of Salta is in the northwest of the country, and we worked on superficial waters in the capital region and in the surrounding area. So here we see the Salta state. This is La Caldera. This is separated by these two rivers at the north, and it is separated from Rio Ancho, which cannot be seen on this picture. But in the case of superficial water, our study focused on monitoring the La Caldera River at the north. This river is located next to the La Caldera village, and they don't have sanitation services. We also monitor the Rio Moscotoro River, that is before and after the discharge of the wastewater treatment plant. So this is the coverage area in pink, as you can see. And we also monitor the Arenales River that crosses Salta. And this is River 1 and 2. This is upstream and downstream. The largest wastewater treatment plant in the south of the city. And the coverage area is the one that you can see in orange. So the monitoring started by mid-July 2020, and it was carried out until the end of this month, of this year. In the case of the Arenales River, the monitoring lasted one more year. As I said, superficial waters were characterized from the physical, chemical, biological viewpoint, and also SARS-CoV-2 was detected in the Concentrados River and P-human mononuclease gene, and these last two were selected as candidates as normalizers. So we collected 20 liters of superficial water. They were concentrated to have a final volume of 80 milliliters by using ultrafiltration. We also used the hollow membrane method, and this concentration method had been previously validated and applied to detect other pathogens. On this slide, you can see the results that we got from this monitoring. In red, we can see the concentration of SARS-CoV-2, in green, polyomavirus, and in blue, you can see the RNSAP gene, and in the dotted lines on the same colors, we see the detection limits for each of these pathogens. In the La Caldera River case, we can see that half of the samples had a low concentration of SARS-CoV-2 that was found occasionally. Just for purposes of representation, here you can also see on this figure, you can also see the samples that were non-detectable samples, and arbitrarily they were given the value of half the detection limit. In the case of La Caldera River, no genetic fragments of polyomavirus or RNSAP. In the Rio Mojotoro, the Mojotoro River, things were different. In some samples, we found SARS-CoV-2 concentrations. Half of it was low concentration, also sporadic polyomavirus. And the situation was different in the Arenales River because the Arenales River in the 2 points sampled showed high concentrations of SARS-CoV-2, and also they detected polyomavirus at a very significant concentration in RA2. This was unique because they also detected VNSAP gene. So what we can see here is that both polyomavirus and RNSAP concentrations both were stable during the monitoring period. So these were chosen or selected as normalizers. And so the monitoring went on the Rionella arenales because of the SARS-CoV-2 curve, they realized that they could really follow up on what was happening. In terms of voice waters, 2 cities were studied. First, on the one hand, the Salvador Massa city. This is a small city that is a bordering city located at the north of the state of Salta in the border with Bolivia. Right there, there is a lot of migration and a lot of commercial activity. So the monitoring took place every week. Also, Salta was studied. This is at the capital state. This is the largest city of the state, Salta. Here, monitoring took place 2 weeks. In all cases, specific samples were collected from the different registries. In the case of the Salvador Massa case, this case was possible thanks to active participation of the healthcare personnel of the city and thanks to a cooperation agreement that was entered between the university and the municipality. The monitoring started in 4 sites, but then only 3 continued with a coverage area, as you can see on this figure. Also, this way, it was possible to cover more than 76% of the population of the city. Here you can see some results. These results correspond to the evolution of viral concentration during the monitoring time from the first COVID-19 wave, and for each and every sites of monitoring. In blue, you can see the reported cases. It is interesting to show that here in this point where a high viral concentration was found and it was not possible to be justified with informed cases, the healthcare personnel went to look actively for cases to do the isolation and to cut off viral transmission. So this had an immediate impact. Here we can see the evolution of viral concentration. These are the monitoring points in 1 year and a half. And with all of that information, what was done was to estimate the weighted average for the city. This is where you can see in the lower figure. Here you can see the 2 waves that we have during this period. In this case of the city of Salta and Cerrillos, this work was carried out thanks to a cooperation agreement between the university and Aguas del Norte, that is in charge of the sanitation of the city, and also with the Public Health Ministry of the province of Salta. In this case, 13 areas were analyzed. Here we see they are shown in different colors on this map. So this way, approximately 90% coverage of the population was achieved. These were the users of this sanitation system. And very quickly, I'm going to show you how the samples were processed. The samples were taken in a cold chain to the university. A fraction was stored for future analysis, and a 40 milliliter sample of the inactivated sample was added to PEG 8000 and sodium chloride. It was stirred for full dissolution. It was centrifuged, and the pellet obtained was placed in trisol to do the RNA extraction and the further detection. Here at this point, it is important to mention that at that point in time in Salta, some people from the epidemiological office and from the province government had been working on an app in order to have a control of what was going on epidemiologically. So this app, which was called Salta COVID, this was an app, and it allowed to record people with symptoms. So people were geo-referenced. So this allowed to have real-time information about all cases that were present in the study areas, and also classified based on the severity of the symptoms. So with this information, we were able, in this first wave, to depict the representation on the one hand on red of the viral concentration found in wastewaters. You can see this on the left axis, and on the other side on the right axis. And with the green curves, you can see the cases reported through the app. Here you can see that many of the areas that were studied, the peaks of viral concentration in wastewaters, this was anticipated or seen before the clinical cases. All of this information would be reported to the healthcare authorities, and also what was done in order to facilitate visualization and interpretation was to prepare these maps like traffic lights, where we gave a different color to depending on the viral load found. The green is a lower concentration rate, 10 to 4 to 10 to 5 genome copies per liter, 10 to 5, 10 to 6 in yellow, orange 10 to 7, and the red was for the highest range of viral load. So with all of these maps, we can see the evolution of the viral circulation in this first wave. Clearly, we can see where the peak was. And so monitoring went on this graph. You can see all the information gathered from the monitoring point, knowing the population of all of these areas. Then a weighted average was estimated for the entire city. And this information is the one that is represented in the orange curve. On the other hand, on this graph, we can also see in the blue line, we can see the viral concentration in monitoring of the Arenales River. This is the RA2, as I had shown you. As you can see, the curves are very similar, and they show what is going on in the population. The only discrepancy is found right there in that area. This is during summertime, but this is really obvious because of the rainfall during summer, and rainfall had a dilution effects, particularly in the river. Also, if we look at the same curves, if we compare them to reported cases, we can see that the peaks or the dynamics are matched. Here we can see that the peak of the first wave was very sharp. It went up and down quickly. However, that didn't happen during the second wave. Here you can see that although the amount of cases reported in the second wave was higher, the viral concentration was smaller. And of course, this is due to the immunization level that the population had. This is due to the vaccines. In terms of the third wave, here, no longer did we monitor the river, but we can see in blue, we can see the viral concentration, the weighted average for the city, and in red, you see the COVID cases. Here we can see the peak and the wastewaters. Once again, this was before the epidemiological cases, and this is how the map looked like. Everything was red. But what I want to highlight is that here, at this point of December 15th, 2021, this was, we got a viral concentration which was very high. In fact, it was the highest viral concentration since the beginning of the monitoring. This didn't really correspond to the amount of cases reported. So this really attracted the attention of the healthcare authorities, and they forced us to include another color in this color coding to explain for such high concentration. So the increase of more than 100 times viral concentration that we saw in these two samplers, plus the fact that December 15th, we started monitoring of the variants of concern, all of that really allowed us to realize that we were witnessing the advance of the Omicron variable that was displacing the other two circulating variants, and this was confirmed a bit later. So as conclusions, I want to say that monitoring wastewaters and superficial waters allows us to observe the dynamics of the viral circulation in the population, and it allows us to estimate the size of asymptomatic infections. It also allows us to detect outbreaks early and the appearance of new variants. These are anonymous, population, non-invasive, and do not depend on the testing rates or the populations reports. This is a lot of work. This was possible thanks to the intense activity of our work team, and thanks to the collaboration of different people from different institutions, from the water company, from the government of the state, and the different ministries. And of course, thanks to the financing of this project, and thanks to the material and logistics support from the authorities of the university and different institutions. To all of them, many thanks.
Muchas gracias, Verónica.
Thank you, Veronica. Now we want to ask our next speaker, Francisco, to share his screen. Thank you.
Está en mute.
Ahora sí.
Listo, gracias.
Can you see it now? Yes, we do. Thank you. Good afternoon to all of you, and thank you for inviting me to join you in this meeting. Thank you, Veronica, to be able to present what we did in this case, having the data that you have found since December 15, basically, and to better understand what happened. I will have here some pre-definitions of the indicators that we are using in this epidemiological surveillance, which is the effective reproductive number, or RT, where we mention also the transmission and the measures that are used to contain the pandemic. And this indicator was mainly used in the third wave of COVID. During the second one, basically, it was not used. Another of the indicators that we take into account at all times during the pandemic was the duplication time that was held for or by the health institution, which is very helpful when these cases increase in one specific time, and also to define parameters of sanitary or health and epidemiological risk. And we see the incidence of a contagion. And here I'm making the presentation of these three indicators to be clear and to know how we can assess epidemiological risk throughout the pandemic, specifically during the third wave. And the data that I will be presenting to you basically are related to the province of Salta, that includes 50% of the province with more than 700,000 inhabitants, that has great impact of Salta in the department of Caldera. Here we can see what has been the development of the entire wave of the pandemic since March of 2020, of March 17 of this year, where we have differentiated the three large waves, the first, second, and third waves. And during the third one, we can see we find quite high values, but for a shorter time. Throughout this assessment, well, we did it with the project that we have in order to obtain the RT number, and we can see it here, and we see how it has changed throughout the pandemic with important values during the first wave. Here we have a large number of people that were prone to get infected, and then we work with Kincomicin to see how they were excluding some cases and what was the impact of lockdown and mechanical respiratory assistance. During the second wave, basically didn't change much the RT values, but then we had a different situation during the third wave, where we analyze the situation as Veronica presented, where we found the Omicron variant. So we started to carry out this data analysis during the third wave in real time. We receive information that was obtained from wastewater, and also here we can see the performance of that third wave. And we started working with it as of the 1st of October of last year, where we interpreted that the third wave could be at the expense of the Delta variant, but that didn't happen because really they were at values very close to the ideal value, but there were no big changes. But that's not the case when we see the emergence of Omicron from wastewater. So here we can look at the sequence of what is the correlation of the different maps of wastewaters of the capital area. And this one, which is a little bit different, and this is the map that allows us to have a turning point and to reconsider the way and the epidemiological source that we were using. So what we need to emphasize, and this was before the first cases of COVID because of the Omicron variant happened here, I would like to say that in the first Omicron case, a person from the United States presented it. It was an important case, but it has not to do with polluted water, for example. But in December 27, it was different, where we were able to identify the 4 probable Omicron cases. It's a diagnosis that was carried out by the thermomolecular lab. So we, based on this map, we were looking forward of what could happen. So we changed this epidemiological surveillance. This is the map that we were looking at before we even knew what was happening with Omicron. So what we show you on this chart is the assessment of the duplication time as of the 1st of October, with a duplication time of 1,236 days. We look at the map having more departments that had low risk and that were in green, and also medium risk in yellow, with a presence of Omicron cases, which exactly the same as those real cases, with the except that by mid of December, where we have all these cases, there was a gap. So we need to reconsider and to analyze what was happening with these curves. And this is the epidemiological scenario to look once more to the duplication time. And this was close to 50 days. So just to this alert, and that what we had from wastewaters, well, was not found out based on the risk based by department, but we started looking at the duplication time. But through time, what we found out is that real cases were higher than theoretical cases that were presented with the duplication time. And so after a few days, we analyzed once more the duplication time, and it has a sudden increase, and we see this negative steep end after a few days, after the first week, basically in the first week of January. So at that time, we tried to control that, and like the surgeries or patients that were hospitalized and that were not vaccinated and also or immunized. So here we look at the COI where they change some measures, especially prevention measures, and not authorizing to have parties with a large amount of people. So different interventions were and activities were implemented to try to contain this situation. This is what we found out in December. And after that, we see that there's a high risk in red, the capital department, and then other departments were turning red, and finally all the province turned out to be red. But this area of Salta and Gran Salta was transformed of an epidemiological alert based on this risk. And it matches this map that we're presenting in this other side. What is important, and this is on real time at this moment, is that wastewaters is anticipated to the risk of the epidemiological map of 15 days. This is after the map that is made by the high risk department. We found out that there was a direct relationship once we have the duplication time of cases. But when the Omicron variant started in the province of Salta, specifically in the capital department, there is an important peak in cases that resulted in a quick increase. All of that is real time. And this is looking at this information in retrospective once the third wave was over. So we were working with the RT and with the duplication time and with the traffic light maps that reached the same conclusion with the emergence of SARS-CoV-2 with the Omicron in wastewaters is ahead of what we were able to see at a population level. And just as comments and our experience, we can say that the SARS-CoV-2 analysis in wastewaters represents to be a useful tool to anticipate surveillance for COVID-19 at a population level. And water provides us a lot of a large amount of data, and the presence of SARS-CoV-2 in wastewater follow patterns that are correlated to the epidemiological curve of COVID-19 and indicators like duplication time and effective reproductive number. And 10 in 15 days before the confirmation of having it present, it is present in wastewater, in the pattern of this department is anticipating the evaluation of levels every 2 weeks of the incidence case for every 100,000 inhabitants. And so this is the point of view of epidemiological survey. We need to use this tool so that it will be a supplement and a part of the tool that we can have in our country. I want to thank the entire team of this epidemiological surveillance program, the one that carried out this daily work, having the collaboration of other people. And of course, all of these works by having the collaboration of the lab, the staff, people in field, of the different labs, and all the labs that process all these samples, water samples, and all the clinical components. So thank you so much to all the participants, for all of you that were working with us to analyze all of these cases. Thank you so much. So this is an application of the use of wastewater analysis. So that was used by the Salta province. Thank you, Francisco. Thank you, Veronica, for telling us about the experience you had in Argentina. Now we will give the floor to Dr. Gaguero. Now you can share. I think that I will be able to share my screen now.
Can you see my screen? Yes, we can. Good. I was gonna say many things, but I'm gonna be brief. I apologize because of this technology issue. I changed the software in my computer and then it was no longer compatible with Zoom. And you know, Murphy's law is always present. I'm having a problem in my Wi-Fi, so I apologize. I hope the best is for me to turn off my camera so that the broadcast, the transmission will be better. Can you hear me? Yes. Yes, we can. Good. All right. So
perdonen, ¿eh? Ya es demasiado. Ahí sí se ve, ¿cierto?
Can you hear? Can you see it?
Como teníamos planificado esto, fue completamente al revés. Ustedes ya vieron la primera.
Well, you've seen already the Jorge's first presentation, and he spoke about the markers in wastewaters, and I was gonna give you a brief summary of the results of the consortium, and this is what I'm gonna try to do. The consortium was created at the beginning of 2021 in our country. It was a consortium of university laboratories that work with wastewaters. It is made up by different university laboratories, many of which stopped researching to detect SARS-CoV-2. There's a first group that you heard of, Jorge. He works at the Valparaiso University together with the doctor from the university in our joint product to detect wastewaters, SARS-CoV-2 in wastewaters. And we have Dr. Claudia Ibacache from the Valparaiso University. She also has a joint project with a laboratory, ANIT, through a laboratory in Lima. They're also working on this issue. And we also have Dr. Andrés Arraiz and Matthias Hep, they've been able to finance their projects through regional funds. Later, I'm going to tell you about that. Dr. Cesar Echeverria, that is an academician from the Atacama University. He also joined in these activities to detect the virus. And in my particular case, also, we would detect viruses in wastewaters, but because of the pandemic, we thought it would be important also to keep doing it. Altogether, I want to tell you that Dr. Paulina Asma, that was from the Science and Technology Ministry, she really pushed this project. And the creation of this consortium is thanks to her motivation. I'm gonna try to dwell on some details. I don't have much time. I don't want to abuse the little time I have, so I'm gonna speak about general things only. The first laboratory in this third region, laboratory of the Atacama University, Dr. Cesar Echeverria. Here you can see a slide, and they dealt with this topic. However, obviously, I'm not gonna be dwelling on the details because I don't have time, right? So initially, well, this is the third region of the country. They only focused on the detection of the virus on the capital city of the region. Here we can see the relationship between the viral load that they detected between January the 1st and June the 5th last year. And here you can see the viral load in bars. And here you can see the number of cases reported in gray, in light gray. And here you see the accumulated cases over time, as well as many other previous presentations. Here we can see that the dynamics emergence of viral RNA precedes the increase of cases in the community. In the fifth region, at the Valparaiso University Laboratory with Claudia Ibacache, they worked on different areas of this region because this region has 32 wastewater treatment plants. She has sampled several of those plants, both at Viña del Mar, Valparaíso, San Felipe, Los Andes, and she detected this virus. And here on these graphs, we can see the viral load obtained from on those dates versus the active cases and the different regions and in the different points of the sampling. And also, this follows the same correlation of what has been said. In the eighth region of the Catholic University, Santissima Concepcion, where we have Dr. Matthias Hep, Luisa Reis, they perhaps were the only laboratory in our country that did something as what Veronica said a while ago. They also put together this traffic light system in a region of San Pedro, where they took some samples from sewage and then they related this to the active cases and they saw a relationship with the CEREMI in order to make an analysis of the data, but also to use them. I'm not going to be talking much more about this because we don't have much time, but a bit of the information that Dr. Hep sent me is how they are now detecting the virus and variants in wastewaters in the entire Biobío region. They are analyzing 30 communities at the treatment plant, and not only are they detecting the viral load, but they also detect the presence of variants. And this is what they've seen in one city of the region, which is called Los Angeles. Here we have the rate of new cases over time. And in the blue bar, we have the RNA copies or the RNA viral load. And also for each and every times, the different variants, undoubtedly, these were detected before the variants were detected in the community, particularly the Omicron variant that was detected in January this year. And the same they did in the Concepcion city, in Talcahuano, Hualpén. You can see the dynamics in this period where they found a high viral load, and this preceded the increase in the community cases. This reiterates an early warning system and the impact this may have in public health. Here, this is a global vision of a sector of Rio Bio and the Concepcion city in Santiago La Paz. This is an analysis from January, from the 21st, all the way to December of 21. And you can see the evolution of cases of COVID over time. And you can see also the evolution of viral RNA detection. It is interesting to see or to point out how all of this was due to increase in immunization. Here we had 58, 56% of the population, 81% of the population immunized with the first dose. And also here we can see that there was an evolution over time. The circulating variants in the last few times with the Delta variant, and later with Omicron that has been detected in other cities, like here. A very similar study was conducted. I apologize, I'm going very fast, but I don't want to abuse the little time I have. In the 5th region and in the metropolitan region, as I said earlier, we work with 2 laboratories to deal with this problem, with Dr. Aiko Adel and Dr. Jorge Olivares. And in the first stage, between June 18th and January of 2020 and January 2021, they detected the virus based on the viral load in 8 sampling points, 6 of the sewage, and in two in wastewater treatment plants. And this is the evolution through the phases that we went through. In the first phase, when we had the lockdown, when we were in quarantine, this started to drop. Then we went to phase 2. In phase 2, the city started to open up a little. People started circulating, of course, with some restrictions. This allowed to increase viral detection. Then we went to phase 3, and then we ended up here. And this is where we are back in work. The same was did with the La Farfana plant. This is the largest wastewater treatment plant in the metropolitan region. La Farfana must be one of the largest plants, wastewater treatment plants in Latin America. Here you can see the behavior over time with the detection of the viral RNA load and versus the incidence load of active cases. And the same in Curacaví. This is a town that is outside the metropolitan region. It is outside the city of Santiago. And just to finish, very briefly, I wanted to show you something that we've done in the environmental virology laboratory in Chile, in a region. These are the plants that I mentioned earlier. This is La Farfana and El Trabal. Both plants are treating 85% of wastewaters in the metropolitan region. We're talking about 7 million. Here we have the geolocation of these wastewater treatment plants. And this is just to show you what we've done from the early pandemic, from early 2020 and up until the present time. We detected the virus in these 2 waste treatment plants. Just to remember that in our country, the first case reported was in March the 4th. It was in Talca, not in Santiago. Therefore, the first samples we analyzed were negative until in May 2020, we detected the first positive sample. And from there on, we practically, as you can see, had the first wave, the big The first big breakout, the first wave concentrated in Santiago, it didn't affect the rest of the country. However, later the virus started to spread into the rest of the country. This is what we've seen in terms of the number of cases for every 100,000 inhabitants. And in this case, in the green bars, you see the summation. This is the RNA copies at La Farfana and El Trebal. Here we can add the analysis on the circulation of the various variants in our city. The wild type was the circulating one, and then the gamma, lambda, alpha variants until now, having in the last few months, having only Omicron. And we in January detected B1. At the end of February, we were able to detect B1, but also in the samples in March, we had circulations of B1 and BA2 as Omicron variants. So initially, we always try to identify a particular virus, as we did with SARS-CoV-2 or other classical enteric viruses. However, we needed to go, as it was said, we had to try to implement new techniques to know that we can do genomic testing. We have access to this technology, not only trying to find one particular virus, but to see what is there in the sample and then to have a bioinformatic analysis. This is just for you to see this heat map. This is what we did, the different samples collected, different wastewater treatment plants in the city of Santiago. And these are two astrovirus, norovirus. This is a classical virus that affects the GI tract. Perhaps the norovirus is the most important for epidemic gastroenteritis. And this is how we can detect those viruses that with the classical techniques we couldn't detect. We didn't know these were circulating viruses. And just to finalize, and I apologize once again, what can we see in 1 liter of wastewater? 1 liter of wastewater, it gives us a lot of information. We can detect microorganisms, viruses, bacteria, parasites, antibiotic-resistant bacteria, as has been said, also abuse substances of different type, biological markers, fluorinated compounds, drugs, etc. And just to conclude, thank you. And once again, I apologize for the technological inconveniences. Thank you very much, Aldo. Let us now move on to the Q&A session. Before asking Argentina and Brazil, it's better if I ask you first.
My question is related to how important is the political will to be able to implement environmental epidemiological programs, to be able to have information from that 1 liter of water? That's an excellent question, Marco. As a consortium, we had an asymmetric budget. We had funding in some of our research program, and we do this, as we said here, basically with a few funds, but that will not last in the medium, or it's only for the short run, not for medium or long term. We have had many conversations with the Ministry of Sciences, as we have heard already, CEMET that has paid more attention to this topic, and we try to have projects funded. Some of them are funded, but is not a long-term funding. Probably today, where we have been more successful in these conversations in the Biobío region, the 8th region, where the dialogue between the sanitary authorities and regional government and the academia, specifically Matias, Paulina, and Andres, have been able to carry out a project that has regional funding and that will be sustainable for these 2 or 3 years. But the rest, well, we are making all efforts. We have tried to talk to the sanitary authorities. I think that there is a lack of knowledge Just like Jorge, I was invited to be part of a roundtable during the pandemic. You know that we had a recent change of administration, new conversation and dialogue networks were created, and the Ministry of Health had a pandemic table to deal with the topic of the global pandemic. And as part of that, we were invited to participate. Jorge and I were there. And we will delve in trying to convince our sanitary authorities to implement this, as Marine showed that as they are doing it in Brazil. In Brazil, they have a very different dynamic regardless of the problems they have. However, the awareness of our authority is not there yet, but I know that at least they're interested in that. Look at what is happening with polio worldwide. If we do not implement this as something permanent, not only SARS-CoV-2, which is a viral that I think that will be transient in the short term, so that we can go back to that normalcy that we've lost. However, there are some other topics which are extremely important, and this methodology, which is much more economical, as Veronica has mentioned here, we see millions of virus that has been excreted by people who are part of the population, and it is more economical than just carrying out analysis individually. So once we present this economic part on the table and we present this mindset, probably we will achieve what many European countries have been able to use for many years now, but also that was achieved after a long and strong effort. So we need to move forward. So I think that Panacea can be an extraordinary tool, so that we will be joined as Latin American countries to have a network, and also in our own individual countries to carry out the effort to implement really this tool. I don't know if I answered to your question. Yes, you did. Thank you so much. Thank you. And also to listen about the political interest and will. Now let's move to the case of Brazil. Do you want me to speak to you in English or in Spanish? It would be better if you speak in Spanish. Okay, now related to the northern part of Brazil, you were telling us that there were not too many wastewater treatment plants. And my question is how could Brazil implement wastewater-based epidemiology in these areas? I think that this would be a very important tool to be used in this region. The problem that we have, as I just mentioned, is that we needed to have the agreement of decision makers, is that usually they can look at this as a project or develop several projects to try to achieve something in this region, because we have important centers, even reference labs of WHO. So we also have a foundation which is also working with the environmental area and analyzing other pathogens. So I think this is crucial, because it is a region where the rate of sanitation is very, very low, probably the lowest that we have in the country. What happens is if we don't have the politicians or decision makers to be convinced that they need to allocate resources to work for that and to improve the health condition of the population, because they need to invest more for health, then this would be very, very hard. And this is my constant concern. Like at the beginning of the pandemic, in having all these different initiatives, I was always deeply concerned on how to have continuity for this work. I have seen that universities work on a project-to-project basis. This cannot be just a project. It needs to be something that needs to be included and to be part of the different organizations, state organizations. Yes, the university can be working on this, but we need to allocate resources so that the university will be able to do this work. So resources, financial resources are required in order to implement these labs, to start working on this. So if we have no contribution in resources, then those institutions would not be able to do the work. So this is something that it is an important region. So the Ministry of Health needs to look at this differently. We needed to convince decision makers and also for politicians to allocate funds, to have stable funds, to include this tool, which is so important and is much more economical in several scenarios. If we don't, then it's going to be very difficult. So we need to do our best to achieve this, to raise awareness among lawmakers and decision makers. Yes, thank you so much. I have another question which was presented in the chat, and it was for you, but probably Renata can answer that. And here, what is the coordination of wastewater, the Ministry of Health and public health institutions? Have you considered that the results of wastewaters were translated into actions or not? I don't know if Renata would like to answer. I think that I can say something about this, and then Renata can add up another comment. What happens here is that based on all these initiatives, all this information is available for all health institutions. And it is important to have all this, but to be honest, I don't know how much they're using it in order to make decisions. I know that there are 2 cases that were a success, a local success. This is something that Tatiana was working in that cases. Where all decisions related to health were based on information, but also the municipalities need to consider information of environmental monitoring to aim their actions, health actions before the pandemic. But there is some frustration is for the health sector to use all that wealth of data to assist them in their decision-making process. I don't know if Renata can add up something, because the area of antibiotics and the environmental part are part of these problems, somehow different, because we already have the program that is resisting antimicrobial resistance. I don't know if Renata would like to add up a comment. Your microphone is off. Renata, would you like to open up your mic, please? Unmute yourself. Renata? I think she's not able to listen to me. If not, then we can move directly to the case of Argentina now and to pose those 2 questions. Thank you, Maria Inés. Thank you, Marcos, Maria Inés and Marco. We have a couple of questions. First for Veronica. a technical question first and another one which is more complex, so I will pose both of them at the same time. When using the refiltering, ultrafiltering system, what is the percentage of RNA recovery? And another question is, you were saying that the effect of vaccines decrease the viral load in wastewater. Is a way, or can you tell us if this was validated and how, or if this can be compared to the previous cases that you had at that time? Or what will you do with those validations of viral loads? Thank you for the questions, Julian. Well, first, I will answer the application of ultrafiltering, and that was used for the concentration of surface waters, of river waters. And the question was about the percentage of RNA recovery. It is important to know that in this case, we made some recovery analysis at the beginning, but this ultrafiltering system has been characterized in many other occasions because, as I said, we have been using it for 15 years. So what we learn through time is that when using internal controls to know what is the recovery rate, this can be quite variable, going from a low percentage close to 10%, or it can get to those cases where the percentage of recovery is very high, getting to 80 or 85%. This is very important to bear in mind because on the one hand, this is due to that each sample has its own specificity. There might be from the same sampling point or from the same river, but there are many other environmental factors that impact the composition of that sample. And something which is outstanding is also rainfall. In the case of our rivers during summertime, and they show a large amount of sediments. So these sediments is so important, and they make rivers to look as if they were chocolate rivers. So having the presence of sediment or some other chemicals or biological compounds or DNA even, which is non-target, they can impact that percentage of recovery. So when we say, for example, that a sample is not detectable for one specific target, we can calculate what it is called the detection limit for each sample, because we take into account those specificities of each sample. And this can be estimated taking into account the recovery rate, the methodology used, and the specificities of the processing and the methodologies used. So the recovery rate is quite variable, as I just said. And I forgot the second question about the viral load that decrease after immunization. Okay, well, what happens is that I have some charts where we can clearly see, because of time, I was not able to show it to you today, but in there we have the doses that were applied through time, and clearly we can see that while those applied doses increase, the viral load decreases. So that during the second wave that I showed you, not only the peak to be a lower peak, but also we had a curve with a wider base. So a viral load which is high through a longer time without having an acute peak like in the case of the first wave. Okay, thank you. There's another question for the case of Argentina, and this is for Francisco Garcia. Have you analyzed the economic benefits or other kind of benefits of using the information of wastewaters? And also based on your experience in your field, what is the conclusion? I think that you make a comparison of wastewater and some other methods. What is the conclusion? Really is, can this method will replace conventional methods or will be supplementary? A supplementary one. Hello?
Adelante.
Sí, no, tuve que cambiar de dispositivo.
Sorry, I have to change my device. Yes, we consider wastewater analysis as a supplementary process in everything related to the epidemiological comparison. We cannot work with only one tool. That is why it was important today to show the usefulness of these three basic indicators and to assess the presence of SARS-CoV-2 in wastewaters is useful when carrying out the epidemiological scenario. Now, if you're talking about economic benefits, then I understand that it's basically more economical to test the population. Yes, because we will anticipate what will come, and in this way health services or contingency would be prepared for those cases, so decision making processes will be better and in a shorter time.
La pregunta. Entiendo, y eso, bueno, lo puede...
And also, based on what I understand, and probably Veronica can mention, the studies of water sample are expensive, but the impact that they will have at a populational level, it will be more economical instead of having mass analysis or tests done, where we need to place many human resources that will be taking samples to analyze the patient and to control the reagents as well. So I think this is something that need to be assessed and we need to consider it as well. Thank you. Thank you all to the speakers of the different national cases, Brazil, Argentina, and Chile. And we're moving to general conclusions. And for this, I would like to give the floor to Marcos Quintela and Pablo Rivera.
Thank you, Julian. As general conclusions, and to be very specific, I can tell you that 4 words I would like to underscore from this presentation. The first is the diversification of techniques. I agree with Dr. Grimsley that it is important to have monitoring of vulnerable populations. During her presentation, she spoke about monitoring diseases at earlier stages, and as countries, we need to have stronger monitoring on certain populations, just as they did in the UK, where they were able to have this huge coverage of the population. And as part of technique diversifications, to use different techniques, as Dr. Grimsley and Dr. Veronica and Dr. Aldo told us, and that has to do with the clinical activities as well. Also, knowledge transfer. Knowledge transfer is really important, as Dr. Street told us, because knowledge transfer is critical. In the world, we never thought we would need to develop this type of monitoring in such a short time. However, all the laboratories helped face these challenges, and just as we're doing in this workshop. And the third big conclusion is that we need to focus on research to diversify different approaches. Dr. Velázquez, Jorge Olivares, and they told us, they gave us a big perspective on the use and abuse of antibiotics. They gave us clinical, environmental viewpoints, and they remind us of using data that become information thanks to the research they mentioned. Now we see the circulation of Klebsiella pneumonia and also multi-drug resistance in Mexico, and also the use of the river watersheds where where we find this antibiotic resistance. And finally, the last word is sensitization. I agree with Dr. Maria Inés that she was telling us that the sensitization topics are very important in health matters. This has been a challenge for all countries, but definitely this has had a huge impact in how to handle this situation in each country. So these are my 4 conclusions. Marcos, can you share yours with us? Thank you, Pablo. I also wanted to add something. The first conclusion is that, as we've seen, we can get a lot of information from water monitoring. We can find coronaviruses, noroviruses, enteric viruses, antibiotic resistant bacteria, polio, you know. And you know, it is not as expensive considering the level of the population. Also, adjustments in the different countries. We see that in the United Kingdom, they do these frequent samplings. In South Africa also, and in other sites, they don't have the capacity to do the sampling. So we live in a globalized world. We need to have an international epidemiological surveillance system. We need to have daily sampling so that things really make sense. Another important conclusion is how we can escalate the pilot projects, local regional projects. How can we escalate them in Latin America and to the rest of the world? That is important, not to lose the capacity that we have. Capacity has been created for the last 2 years on this virus, and these capacities had not been created in the last 30, 40 years. We should not lose that. Another important point is the area of sensitization, how to create sensitization of public health, how to raise awareness of sustainable projects and projects that will be more comprehensive in public health. And finally, I think that the last conclusion is that we are academicians, so we need to get financing. We need to focus on how to get some long-term financing for innovation and for development. Health technology, we provide innovation, but someone in the long run will need to give us some funding. We academicians just give innovation. And so in this group, in Panacea, and in many other groups, there's a lot to contribute with. We have people that have been working for many years in this area. I believe that intellectual capacity is very important. The intellectual capacity is greater than having a monitoring system. And I would like to finish here. And thank you very much to everyone. Julian? Thank you, Marcos. I'm gonna take 1 more minute just to show you the numbers of the attendees to this workshop. We had more than 400 people enrolled. The first day, 820 visualizations or views. Day 2, live, close to 100 views in both channels. Hopefully, we will increase the number of, hopefully in the next few days, we will have more views. And we also had English, Spanish translation. And because this is helpful for views and to socialize and to share these tools, these are the countries that signed up. We had a big coverage in the region, Africa, Europe, Asia. So People ask us how to be part of this Panacea network. This is our email. You've got it in the flyer, and we will come up with some proceedings of this workshop in the next few weeks. We will also make a survey, and we will continue in touch with you. If you have any specific concern, let us know through our email. We must tell that officially this network started working last November. We've been working for a short time, relatively speaking. We will soon be in further contact with you. I just have to thank the speakers. We have top-notch speakers from different parts of the world, particularly the members of the Panacea network that made possible for speakers to take part in this workshop. And I would like to thank the technical team from the engineering department, from the IT department, and the environmental engineering students that were always helping us with the chat, with registration, with the website for this seminar. I just have nothing left to say but to thank them, and I hope we will see you in the future events of our network, and hopefully you will also have an active participation in future events. Thank you very much to everyone.